Distinguished guests, ladies and gentlemen, we would like to move further on and turn to agenda item 5a, which is the roadmap for the implementation of the 2030 Agenda for Sustainable Development, building on the Health 2020 policy framework. Now I have to read the relevant documents. So these are EUR/RC67/9 and EUR/RC67/INFDOC/1 Rev1, which provides information on the joint monitoring framework. Please note that there is a corrigendum, EUR/RC67/9 Core 1. We'll also take up the resolution in document EUR/RC67/ConfDoc/4, and the financial implication can be found in the document EUR/RC67/9 Add 1, and has also a corrigendum EUR/RC67/9 Add 1 Core 1. So these are the documents to follow so that our colleagues can also follow our interesting discussions. Your Excellencies, ladies and gentlemen, on the 25th of September 2015, the United Nations General Assembly adopted Resolution 70/1, containing the document Transforming Our World, the 2030 Agenda for Sustainable Development. The 2030 Agenda is a plan of action for people, the planet, prosperity, peace and partnership, which all countries and stakeholders acting in collaboration will implement. 1 year and a half have passed since the Sustainable Development Goals are in force. 23 European countries have already reported voluntarily to the United Nations High-Level Political Forum. The WHO European region has a comparative advantage as in 2012, the European Policy Framework Health 2020 has been endorsed together with major strategies and action plans in subsequent years that served as implementation pillars. We would like to thank the WHO very much for the development of the roadmap, which we will have the pleasure to discuss today. We will have 2 sessions today discussing this important agenda item. This morning, we will have a first discussion on the roadmap and the draft resolution, and we will continue this afternoon. We will also have 2 panel discussions, one this morning on the vision and implementation in countries, and in our afternoon session, we will focus on the implementation through the multi-sectoral and interagency collaboration. Advancing the Sustainable Development Agenda is a collaborative journey for all of us, and we are committed to leaving no one behind. This means that our work is fundamentally about people. Over the coming years, we will see 6 short films about 6 individuals from across the European region, each of whom has personal experiences with and insights into the agenda topics we are discussing. I would like to thank each of these voices of the region for their valuable contribution. We will begin and see now a video with Tom, and if I'm correct, Tom is also in the room today in Budapest, so we greet Tom, and we will now see together the video with him.
My name's Thomas Blackwell. I'm from Wrexham in North Wales. I'm an avid mountain biker, big football fan, so I'm a referee on a Saturday for the Football Association. From the age of 6, I was taken into care by state authority. We were took into care because my brother went to the police. He'd been quite, I think he'd been hurt quite badly by my mother. He must have been 14 because he's 8 years older than me, so. So from that point onwards, the decisions I could make and the rights I had changed because no longer was it a parent's prerogative to decide what I could do. At an early age, my ability to talk to other children and interact with them was diminished. Just if you're not brought up in the same kind of environment, then you're different anyway, you look different. So I would say throughout my childhood, mental health was the supreme factor in what was damaged and what needed repairing. The most focused on who I was as a person was the charitable sector, and then education. And surprisingly, I would say health wasn't even as focused on me as education. It's very much you had your fitness review, and you know, that was literally, they just wanted to look at you and say, are you being starved? No. Are you ill? No. Goodbye. In terms of leaving no one behind, I think the different authorities and the different groups and systems in place need to have a clearer definition of who's in charge. I think if there's a clear hierarchy in the case of implementing what happens in a child's life, then there'll be possibly less noise when it comes to fighting amongst each other. I came out disadvantaged, and certainly they gave up on me before I gave up on myself. So all that I have achieved since turning around 17, 18, the last few years have been my own doing. I'll be studying a degree in politics mainly because what's happened in my life is focused around the rights that we possess as human beings and what I've been allowed and haven't been allowed to do growing up. I can't wait, 3 months now until I go to university, and it's just 4 years of concentrating on myself and thinking of ways and means to improve myself and improve the way I think and the way I write and my knowledge in something I love. I don't want to be Prime Minister of the United Kingdom, but I'd certainly like to have the Prime Minister's ear. I'd like to influence the way my country's run. And a big part of my development in the last year has gone from I want to I will. Iechyd gwell I pawb.
Thank you very much, Tom, and good luck for you and a lot of strength we wish all. And there are 5 more videos to come in the coming days. And now I would like to welcome once more Mr. Tsipras, Alexis Tsipras, Prime Minister of Greece, who is with us here today and who will share his experience with us about the implementation of the SDGs in Greece. And Mr. Tsipras, we are very pleased to have you here today, and it shows your commitment to health, to universal health, and to coverage and primary health care. So, Mr. Prime Minister Tsipras, you have the floor.
Excellencies, ladies and gentlemen, Honorable Director General of the World Health Organization, I would like to warmly thank you, all of you, for your invitation to speak today at the annual European General Assembly of the World Health Organization. An organization that has the crucial global role in the protection of the health of the world population at a time of great global and regional challenges. It's an honor, but also a great responsibility to represent Greece here today, a country of the European Union that found itself at the epicenter of two of the most important challenges of our time, the economic crisis and the refugee and migrant crisis. Two crises that the international community was not ready for. Two crises that led us, particularly in Europe, to a great dilemma. Do we confront the challenges of our time through solidarity, respect of human dignity, and international law? Or do we decide that the best choice is to protect only our own nation and leave all the other choices to the markets? My country chose the first path, which is also the only path that allows Europe to have a common future. We were hit hard in the field of health by the economic crisis and the austerity measures that were imposed on us, as well as the large number of migrants that entered Greece. But we decided that the only way to protect and support society was to strengthen universal health care and at the same time to try our best so that all vulnerable groups, including immigrants, had access to it. Greece is a country that is going to great lengths in order to heal the wounds of its citizens from the harsh austerity measures of these last 8 years. Measures that have undoubtedly affected the level of health and healthcare of the citizens of Greece. Today, I feel I'm speaking here on behalf of all citizens of the European Union who support its founding principles. European citizens who believe that investing in health means protecting human dignity and social equality and cohesion, against those who want to weaken the social welfare acquis and who believe that health care should be a privilege for only those who can afford it, against those who believe that health care should be a privilege only for the citizens of the country, but not for the immigrants living in it. But as you say here in the World Health Organization, health is not just the lack of illness or disability, but the state of full physical and psychological and social well-being. The promotion of health and healthcare services is a fundamental human and social right. It is not only a question of good healthcare services, but a question of comprehensive policies that prevent the social and economic causes of poor health and illness. Causes like poverty and social exclusion, lack of decent living conditions, or poor diet. And this is why what we need is health policy whose priority is supporting weak and vulnerable groups, aiming at decreasing inequalities. Let us not forget that inequalities contravene the fundamental principles of the World Health Organization and the Alma Ata Declaration of Healthcare for All. In Greece, having experienced in a traumatic way the consequences of austerity policies in the field of public health care and the welfare state, we have been promoting an alternative political program in the last 2 years, based on the following: universal coverage of the population, bias in favor of the public health care system, improvement of management in the healthcare system, eradicating the passive privatization of the healthcare system and burden on citizens through out-of-pocket payments, reforming primary health care, giving more emphasis to the rights of patients. This is our response to the crisis in the healthcare system, to inequalities in access, and to the negative trends in the healthcare of the population, particularly in a period of high risk and multiple challenges to health. Despite the asymmetry between pressing needs and available resources, and despite budgetary restrictions, we have made important steps in this direction by redistributing public expenses and combining resources from the state budget and social insurance. We have succeeded in the following. First, we have ensured the universal, free and equal access of uninsured citizens to the public healthcare system. In this way, we have finally closed the period of healthcare poverty in our country, fulfilling the goal of the World Health Organization and the EU that no one should be left behind. Second, we supported and stabilized the public healthcare system. We increased the percentage of public expenses to GDP from 4.7% in 2015 and 5.1% in 2016-17. We filled many empty doctor and nurse positions in hospitals. We improved the function and the effectiveness of public institutions. We improved transparency as well as public accountability in management. We invested in the development of human resources. We protected the scientific and professional integrity of young doctors, and we're trying to reverse the brain drain. Third, we confronted the problems of corruption and wastefulness in the health system. Fourth, we ensured reliable health care to thousands of refugees and immigrants, including through the vaccination of children, through ensuring that the refugee crisis would not lead to a problem of public health, and through strengthening the culture of solidarity in the Greek society. Fifth, we promoted reforms in the healthcare system that were pending for decades. The most important were the reform of primary health care that is now being organized on the basis of decentralized structures and the strengthening of the institution of the family doctor. And here I would like to underline that the technical support and contribution of the European branch of the World Health Organization in reforming primary health care was extremely valuable. Sixth, we facilitated the access of patients to the necessary innovative medicine, confronting a problem that has existed for many years in Greece, in evaluating pharmaceutical innovation and negotiating affordable prices for expensive medicine where necessary. Of course, there are very important steps to be taken in order to correct the mistakes of the past and to build a modern healthcare system in Greece. We need many more reforms and difficult measures, but at the same time, we need a global understanding that protecting healthcare and human dignity, meeting the Sustainable Development Goals, is not a privilege or a luxury. And this is something that all international institutions have to understand. It is one of the most important tools we have in order to confront the challenges of our age. And I know very well that the World Health Organization is an ally and will be an ally in this effort, and that's why I warmly thank you for the work we are doing in this direction and for your support to my country and to my government's efforts. Thank you very much.
Prime Minister Tsipras, thank you very much for your speech and showing us your support for the health developments in Greece. And now I would like to ask our Regional Director, Zsuzsanna Jakab, to present a proposed roadmap for the implementation of SDGs and to introduce the discussion.
Your Excellencies, Prime Minister Tsipras, Director General, ladies and gentlemen. First of all, let me start by thanking the Hungarian government and particularly the Minister of Human Capacities for the wonderful reception last night on behalf of all of us, and especially for the amazing talents that have been invited to the reception. Your Excellency, Your Excellency, Prime Minister of Greece, Mr. Alexis Tsipras, thank you very much for accepting our invitation and taking your time to come to the Regional Committee, which means a lot for the European member states. This underlines the message that we have been giving all these years, that health is a political choice. Even in countries which are undergoing a situation with economic constraint, you can move forward with universal health coverage, with financial protection of the population, putting the people in the center of the health system. Also strengthening primary health care and also the public health services. We very much appreciate your personal strong support to our work that we have been doing together with Minister of Health, Andreas Santos, and his excellent team on all these issues. And we would like to thank you personally that many times you attend the events that we organize in Greece, like the last event on primary health care. You make speeches and you also stay there to listen to the discussions. All this work that we are doing needs high-level political leadership and commitment, and we have this now in Greece. And this is why our work in Greece will be successful. You take leadership yourself, the intersectoral element is in place, and you can count, Mr. Prime Minister and your team, on full continued support from WHO. Thank you very much. Ladies and gentlemen, please allow me to introduce the topic of the SDGs and its implementation and the roadmap that you have in front of you for the European region. Just to remind all of us, 2 years ago this very month, the 2030 Agenda for Sustainable Development was born. and we, the representatives of the global health community, expressed our commitment. Now it is moving beyond its infancy. As promised, the roadmap before you brings the region's priorities forward and provides a common direction to support you in the implementation. Allow me to thank the Member States and partners who contributed to the consultation process, and this document now is truly a joint product. As the African proverb says, it takes a village to raise a child. It expresses very well the notion that it takes each and every one of us together to advance this agenda. Only together we can achieve better, more equitable health and well-being for all at all ages. Health contributes to and benefits from the SDGs, and not only SDG Goal 3. Countries supported by WHO will be the engine for SDG implementation, and only through addressing all the health-related SDG targets will we achieve the enjoyment of the highest attainable standard of physical and mental health, to which Prime Minister Tsipras also referred to. Health 2020 is fully aligned with the SDGs, and it is the 5th year of its implementation, and it has been shaping the way, paving the way forward, both in shaping the SDG agenda, but also in the implementation. We have made good progress in many areas in the European region. You heard it from me yesterday, like in life expectancy, health of women, children, and adolescents, in the prevention and control of communicable and non-communicable diseases. This progress obviously needs to be sustained and strengthened. However, the pace of the change is slow in some areas, like sexual and reproductive health, mental health, disabilities, violence, injuries, just to mention a few. We also have to finish the unfinished business on MDGs, particularly HIV and drug-resistant tuberculosis, as well as water and sanitation for all. This is our legacy. Meanwhile, we continue to face many global challenges, like antimicrobial resistance, large-scale migration, a changing climate, civil unrest, and emergencies that we have to tackle. Moreover, health inequities persist both within and across the countries. Gender, equity, and human rights are not always mainstreamed throughout all the actions. The Agenda 2030 calls for joint societal efforts for leaving no one behind. It calls for solidarity, engaging global and regional partners in global platform. It calls for increased financing for development, as agreed in Addis Ababa in 2015, and I call upon all European leaders to fulfill these commitments. Financing for development will largely be generated from domestic resources in our region, even though some countries would still require external financial support. What is now needed is investment in health, which many countries can afford. Indeed, investment in health pays off also for the economy. To achieve improvements in health and health equity, we should focus on health policies and health systems for the 21st century within the context of universal health coverage. This must be a core component of national development planning. I request the European leaders to continue to be in the forefront of foreign policy and national and global health financing to ensure that even the poorest have universal access to health. Many of you have already started to localize the Agenda 2030. We need to make sure that efforts across the whole society would reach all, engaging communities, the people, the youth, and the most vulnerable. After all, it is at the local level that our policy coherence becomes tangible and effective. With this roadmap, we aim to highlight actions that can accelerate and strengthen the capacities of member states in implementing the SDGs. It is built on already existing priorities and commitments of member states, particularly Health 2020, taking into account their specific context. Together, we identified 5 interdependent strategic directions. We need the highest level of political commitment because, after all, health is a political choice. We need renewed governance for health, which is more coherent, integrated, consistent, and intersectoral. And we need to integrate health into development policies and build strong accountability and reporting systems. To leave no one behind, we need to focus on 2 streams. Improve the general conditions in which people live, for example, through universal social protection schemes and access to high-quality health and social services, and improve the health of the most vulnerable, such as women, children, minorities, migrants, and refugees. We need a whole-of-government approach to tackle all the health determinants throughout the life course, behavioral, environmental, social, economic, as well as political, commercial, and cultural. And we need to increase the policy coherence between different sectors to specifically address health. Evidence gathering is crucial to promote health in all policies, along with the legal and regulatory frameworks, as well as pricing and fiscal policies for the harmful products. We need to invest into places and settings where people live and work. This requires engagement of all stakeholders, civil society, private sector, local communities, and the people. Networks like the Healthy Cities and Regions for Health Network offer a unique reach and opportunity for collaborative learning, which we will continue to support. In the European region, we are guided by the principles embedded within the Tallinn Charter with the core messages that no one should become poor due to ill health. We develop policies, strategies, and tools to strengthen the capacity of the health systems for universal health coverage. We are focusing on integrated, people-centered care, strengthened public health services, and health financing. In addition, we are working towards environmentally sustainable health systems. Here, financial protection is key, because the poorest people suffer the most financial hardship due to high out-of-pocket payments. We need stronger social protection and pro-poor policies. We also need increased investment for health and share of health expenditure in overall budget needs constant review, since business as usual is not sustainable. Public investment in the health sector is associated with a 2- to 4-fold return to the economy on every euro invested. In the roadmap, we also identified enablers, calling for increased investment for health, as well as systematic assessment of public and private investments across sectors. Second enabler is multi-partner cooperation, which aims coherent policies, shared accountability, and exchange information and experiences. We agreed to join our forces with the regional UN agencies under the issue-based coalition of health, which is led by WHO Euro. We identified 4 priority areas for this work: health throughout the life course, communicable diseases, universal health coverage, and migration. Third enabler is innovation, global interconnectivity, and social mobility to introduce new opportunities for public health, like broader use of media, including social media, for health promotion, disease prevention, and behavioral change. And the Agenda 2030 demands accountability. This requires monitoring and reporting. I am pleased to note that the monitoring and reporting mechanisms are in place, especially with WHO as the custodian agency, and through the European Health Information Initiative, we have made exemplary strides forward. All member states agreed on the need to reduce the reporting burden for the member states. They suggested that a common set of indicators and timelines bridging the SDGs, Health 2020, and NCDs should be developed to merge or pool data collection. For this, we will establish an expert group to further engage member states and will present the proposed set of lists of indicators and timelines for the next regional committee for your consideration and hopefully adoption. At 2 years of age, the success of SDGs is in our hands. We are committed, working with each and every one of you, placing health at the center of development and accelerating SDG implementation. SDGs and the Health 2020 and this roadmap provide us a vision, a strategic path, a set of priorities, and a range of recommendations on what works to improve health and well-being, health equity, and ensure the health of future generations. We will travel through this path together, using WHO's evidence, experience, and know-how. Together, we can make sure that future generations inherit our shared vision for a healthier world. Thank you very much for your attention.
Thank you very much, Dr. Zsuzsanna Jakab, our regional director, and thank you also for the support you provide the member states in general, but also specifically in the implementation of SDGs. And now we will have a panel discussion, but first I would like to thank you, Mr. Prime Minister, for joining us today. And unfortunately, Prime Minister has to leave, so we thank you for your presence and wish you a nice stay in Budapest for the rest of the time. And now we will start our panel. So I would like to ask the panel members to approach the seats, and please be seated here, because this first panel will be focusing on the experience of various member states and the increased governance for health in the SDG era. And I am pleased to hand over to Dr. Luciana Licari, Executive Manager of Country Relations and Corporate Communication, to lead this panel discussion. Please.
Good morning. Good morning, everybody. Good morning. Thank you, Madam Chairman, for passing on the panel. Your Excellencies, Ministers of Health, thank you very much for the opportunity today to be able to present this panel discussion, which is going to be about the roadmap to implement the 2030 Agenda for Sustainable Development. I have the pleasure today to have 4 very high-level panelists, and if you will allow me, I'd like to introduce them to you. We have, excuse me. So we have Dr. David Sergenko, who is the Minister of Labor, Health and Social Affairs of Georgia. He's been minister since 2012. Dr. Sergenko has presided over the establishment of government-funded universal health coverage in 2013, and he is a pediatrician, intensive care specialist, and also a healthcare administrator by profession. We also have Ms. Olivia Wigzell with us. Ms. Wigzell is the Director General of the Swedish National Board of Health and Welfare. She has served as a councillor of the Stockholm County between 1994 and 1998, and she was also Municipal Commissioner and Vice Mayor of Stockholm. She is not new, of course, to politics, but she did leave politics behind to go into the Swedish Association of Health Professionals, and in 2014 she took office as Director General of the Swedish Agency for Health Technology Assessment and Assessment of Social Services. She was appointed Director General of the Swedish National Board of Health and Welfare, and that was in 2014. We also have with us Dr. Christopher Fern. Dr. Fern is Deputy Prime Minister and Minister of Health of Malta. He was appointed Parliamentary Secretary for Health in 2014 and then Minister of Health in 2016. In 2017, he was elected Deputy Prime Minister and Leader of the House. He is a pediatric surgeon by profession, a lecturer at the University of Malta, a medical school, and the founding director of the Malta Institute for Medical Education. And last but not least, we have Mr. Zoltán Balogh, the Minister of Human Capacities of Hungary. He was a member of the National Assembly since 2006 and functioned as a chairperson of the Parliamentary Committee on Human Rights, Minorities, Civic and Religious Affairs between 2006 and 2010. And he was State Secretary for Social Inclusion from 2010 to 2012, before being appointed as Minister of Human Capacities in 2012. So as you see, we have a variety of ministers here with various experiences that are related to today's discussion. In today's discussion, we would like to focus mainly on three questions, which is how can we best increase governance for health and well-being in the SDG era? Does the SDG roadmap enable your country to take the SDG agenda forward at country level? And also, what follow-up would you recommend in terms of the SDG roadmap and, of course, for countries that are here to nationalize or localize the SDG agenda? So I'd like to start with Minister Sergenko. We know that you have submitted a voluntary national review to the High-Level Political Forum in 2016, and we know you are in the process of nationalizing your 2030 agenda. We would really like to hear from you how governance for health and well-being is key to ensuring the implementation of the SDGs in Georgia. So, please.
Thank you very much, Your Excellencies, Director General, dear colleagues. Thank you very much for this great opportunity. When we are discussing how we can improve governance of healthcare in the era of SDGs, there are maybe hundreds or thousands of factors influencing this issue, and because let me break down these issues to allow me present my point of view in three main directions, break down to three groups. First is strong political will, second is cost-effective approaches, and third is our SDGs. Let me discuss first topic, strong political will. As all of us, we know there is no second priority in healthcare, and nobody can answer that which one is more important, some mental health or somatic health, emergency care or vaccination, just no second priority. And healthcare needs more budget, and healthcare needs more opportunities to tackle upcoming issues. But issue also is that state budget also has no second priority. What about education? What about environment, sports, youth, etc., etc.? And because I believe that when we are discussing about strong political will, this is our obligation to ensure our governments that universal health coverage is most cost-effective and the most result-based approach to tackle challenges. And even there is no second priority, but there are some excellent articles showing that healthcare expenditures are not just spent money, but direct investments in countries' economics. And there is nice tables showing that in which direction we are spending in healthcare, let's say €1, and what kind of feedback we are getting from economics. I think more political explanation to our governments that this is literally not just spend money healthcare, but direct investment in economics is the key. And saying honestly, I'm very proud to share with you that government of Georgia since 2012 has been increased healthcare budget by 2.6-folds. And this is really significant increasing that allowed us to tackle a lot of issues. And I think the role of WHO is the key in this creation of strong political will, and I wanted to underline our gratefulness to WHO for their strong support for us, because promotion that literally healthcare expenditures are direct investments in economics are the key, I think. Maybe later on we will have a chance to discuss in more details this first topic, but now let me move to second one, cost-effective approaches and evidence-based approaches. So let's imagine that we are having much more budget, but technologies are improving, expenditures are increasing, challenges are upcoming, and how to choose most cost-effective approaches when with our limited budget we can get maximal impact from our budget. And I think even importance, and nobody refuses importance of new technologies, telemedicine, robotic technologies, some sophisticated pharmaceutical approaches, but I think this is, I believe that this is tip of pyramid of healthcare, and the basement is, in my understanding, I believe this is primary healthcare, and strengthening of primary healthcare, tackling diseases in early stage, avoiding complications, avoiding expenditures, avoiding losing health conditions and life are the key. And prioritization, even we are declaring, and I believe we are agreed that there is no second priority in healthcare, and setting the right priorities are the key to ensure cost-effective approaches to get maximal result from our efforts. And the third subgroup of my point of view is our SDGs. And to explain my point of view regarding SDGs, let me present some example from clinical medicine. Even in human bodies, let's imagine that human body is kind of country's healthcare system, which is always challenging, and every second there's going some millions of processes of offensive, defensive, developing, improving, recovering, etc., etc. And this is literally impossible to monitor all these processes in human body, but there is a universal approach to measure basic life science, basic vital science, like let's say blood pressure, heart rate, respiratory rate, and temperature. If you are having some very well thought and set normal ranges, if you have targets for this just 4 vital signs, and you are controlling them, and you are doing everything possible to keep them within normal ranges, you are controlling more than 80% in human body. And I believe emergency medicine specialists would agree with me that when you are tackling main vital signs, you are tackling, if not everything, but majority of challenges. And in my understanding, and this is my true understanding, that SDGs are like basic vital signs, and this is crucial to establish and set appropriate, let's say, vital signs or SDGs, because nobody can say that which direction is more important. Challenges are upcoming, and the reality is changing very fast. And I believe that establishment of roadmap of SDGs are equally important in healthcare system, that basic vital signs are important in emergency medicine. And this is my point of view regarding these issues, and with your permission, I'll finish my speech with underlining of a sentence that has been mentioned by Director General and Prime Minister of Greece, that healthcare is truly not privilege, not luxury for everybody, but this is a right for everyone. Thank you very much.
Thank you very much, Dr. Sergenko. So what you have emphasized today is basically the need to have tools to monitor the progress of the SDG implementation. You've also talked about the importance of having a participatory approach to ensure the universal health coverage that you'd like to achieve. But what you've also touched upon is the importance of reducing the out-of-pocket payments, which you do, of course, by investing in health. So I'd like to link back to this, to Ms. Wixel. Ms. Wixel, I know that you are an advocate, a key advocate for equity. And in fact, we found out that in 2016, you were actually named the 4th most influential person in Swedish health policy by Wikipedia. So knowing that equity is actually so important for you, we'd really like to hear from you what strategic directions you are already putting into place in order to ensure a more equitable and sustainable health for all ages. Thank you.
Thank you. Yes, I like to promote equity, and so do Sweden as a country. It's a luxury to tell something about our ongoing work in order to reach the goals. We have chosen a very broad approach to reduce health inequalities, and health in Sweden is integrated into all policy making and policy implementation. And our public health policy that goes some years back targets 11 areas. It's everything from city planning to education, labor market, and of course healthcare sector is included there. So the policy is proactive and it aims to promote health and prevent ill health. And we're aiming to close the health gap in 1 generation, but it will be very difficult. Our general level of health is, of course, improving, as for many countries here, in most of our countries, but the inequality gaps remains in Sweden. So even if it's get better, we have the same gap over the years. And we call that, and WHO call that, stubborn inequalities. We have tried with, why stubborn? Because we have tried with many policy measures, but they have not been fruitful. We can't reach or bridge the gap. And we are analyzing now the gaps, and they are often related, of course, to socioeconomic groups. And we are trying to support a more informed-based policy in order to make better in policy interventions to reduce the gaps. And building on that, we will, as you mentioned, Mr. Minister, shift resources from hospital care to primary care in order to increase accessibility and to promote preventive measures. And we will also promote a more person or patient-centered care, building on the patient's needs, wishes, and capacities. And we are also going in the direction where policy targets groups in vulnerable situations, not only a general policy, but also a targeted policy. So we have new policies now in Sweden to reduce drug-related deaths, for example, policies to improve maternal care, policies to improve health for migrants and especially unaccompanied minors, and policies for promoting health for children in social care and for protecting women exposed to violence, for example, and to improve accessibility to knowledge-based interventions for persons with mental ill health. And for children and young people, we have especially worked with digital health and e-health solutions, and also to increase services free of charge. It's everything from dental care to youth clinics that are free of charge in Sweden. So I would say that the Swedish lesson is adopt a broad policy to create good conditions for the entire population, use data and make analysis to understand your stubborn inequalities, the stubborn inequalities you have, and why you have those. Get a better understanding, and use information-based and evidence-based policy to find the right measures to target the stubborn inequalities, and target groups that are vulnerable to ill health, and do it from a person-centered approach that often includes to have a more adapted system and healthcare system, a system that adapts to the person and not the other way around. That is often the fact today. And lastly, I would say follow up your results and your outcomes to learn more for the future interventions. Thank you.
Thank you very much, Ms. Wicksell. And of course, we have to always emphasize the fact that to leave no one behind, we need to start from the bottom up. We need to refer to the local level, and we need to also have good governance, which ensures that there is a political decision to involve all the sectors and ensure multi-sectoral collaboration. And I know I'd like to come to Minister Balogh about this, because I know that Hungary was co-chair of the Open Working Group that led to the development of the SDGs. And I also know that you are in the process of nationalization, and that you personally believe very much in work at the local level and the contribution that it can make, as well as the healthy cities, to the economic growth. But I also believe that you have been a firm advocate for governance for health, and that you have a very valid experience to share in how governance for health and well-being can help with the implementation of the SDGs that you are in the process of starting. Would you like to share your experience?
Yeah, thank you. I would like to speak German. Not to forget this wonderful language of Goethe and Hölderlin, and not to speak about Hegel and others. So, herzlichen Dank.
Yes, thank you very much. Yes, it is a real pleasure and privilege to be co-chairs here in the Open-Ended Working Group. But we are committed to the goals of this group. Now, my first point is perception. Now, I'm no professional politician. I come from the basis. I work with many civil society organisations. I've worked with social partners. And there is a gap between the political elite and the population. And this is something that we need to think about. We need to realise that the world around us, well, this is a fragmented world. So we need to speak about sustainability, not just about competitiveness, not just about economic growth, not just about resources, but we should also realise that we need to improve the world around us. And we need to think about the next generation. Now, we think that's something that's self-evident, but it's not. I think this is a matter of education. It starts at school, so that the young generation are aware of the fact that the world is fragmented and breakable, and we need to have a rethink of the whole system and adapt the system rather to make it sustainable. And this should be a key aspect. Now, sustainability also means, and this is something that's very important for me, this means that we have intersectional aspect. This means that various departments of the government work together. In my region, I have the honour of having a Minister for Human Capacities. Yes, culture and education come into play here. Social policy, health policy, and family policy are all included within a single ministry. Sport is included, minority groups are included. So that means we have a broad portfolio of where we need to work intersectorally. That's something that we are doing in all the programs that we have, all of the health programs at school, health programs with disadvantaged groups, they are all closely connected with one another. What we have realized in Central Europe and in Eastern Europe is that well-being and welfare are dangerous words, so to speak, because instead of welfare, we speak about workfare, a workfare society. We need to make it clear in Europe that we need to work more in the future to maintain the same standard of living. That's one point. Now, another point I want to make, and this has also been mentioned, is that we need to be looking at the gaps that exist in our society between those who earn well and those who are on lower incomes. We need to think about access. They have access to the health system. We've got a very specific issue here with the Roma population, and we need to do more here. Access does not just mean having access to resources, not just access to finance, but it also has socioeconomic. It also has the socioeconomic background. For some people, it's very difficult to have access to healthcare resources because they have a different way of life. And this social background of the Roma community in Hungary is something that we've been looking at for some time now. In 2011, we developed a Roma framework when we had the EU presidency. So we invited 1,000 Roma women to attend, and these women had the task of acting as a mediator between the Roma families and doctors and the health services and schools, between social workers and the Roma population. So there was help on both sides to bridge the gap between the Roma community and the medical community and social community. Of course, we have our own framework to achieve the goals. That's something that's very important for us. And another point I would like to make is a healthy workforce. More discussion and more coordination and more cooperation with employers. And we have a real need for this in Hungary. We have a need for medical examinations, and we want to look at tax cuts for employers so that they can improve the health of their workers, and so they can encourage workers to undertake routine medical checkups. Yes, when it's free, men and women take advantage of these medical examinations, 30 to 40%, but you want to increase these medical examinations. Now, what you mentioned about Georgia, about economic potential, and seeing that as investment in the health system, I would now like to touch upon a social aspect. Yes, we can invest more money in the health system, but where does the money arrive? Does it reach the lobby groups, or does it really reach the people who need it? I think it's very important to not talk about how much money we invest, but we should talk about how this money is being allocated and how we can ensure that it really achieves specific goals. Now, a few other points. In a country like Hungary, there's the issue of the protection of non-smokers. We have an environment where non-smokers have advantages. For example, in public institutions and on the streets, there are smoke-free areas. And this is something that's really taken up in our country. Within the space of a few years, the number of smokers decreased by 200,000. So this brings me on to my next point. Yes, we have taxed food products, risk products, so to speak, and with this tax, we have invested it back into the health system. So we taxed salty and sugary foods in Hungary. And now I would like to talk about sport and the school system. Yes, we have PE every day in school. According to EU statistics, Hungarian children do the most exercise every day. This is a real success story. 80% of the pupils support this program, and 70% of the parents support this program, and 40% of the teachers. Yes, it's a bit complicated for teachers to organise the school day, of course. Now, we have these national exams at the highest political level, and focus is placed on water and sanitation. Efforts are being undertaken to make water resources sustainable and to ensure that people have access to water at all societal levels and at a global level. Thank you very much.
Thank you very much, Mr. Minister Bolak. You have emphasized very much the importance of investment, and also investment in the appropriate places, because you talked also about the need to make sure that the money reaches the needy and goes to the right places. You've also talked about the incentives that you put into place with regards to the taxes on unhealthy foods. But what was very interesting was that you also mentioned that these tax incentives are fed back into the health. You spoke about not only addressing the vulnerable populations, that is the Roma populations, but also how you involve them with participatory approaches to assist you with ensuring that you leave no one behind. But I'd like to link to the multi-sectoral approaches that you were talking about, because you were, of course, you're a country that has a unique opportunity to bring sectors together, as I know you have what we like to call a super ministry, where you have a number of sectors working together on a day-to-day basis. Linking to this and going back to the Deputy Prime Minister of Malta, I know that you have had experience also not only in multi-sectoral collaboration, but also in multi-country cooperation. You held the presidency, the EU presidency, in the first part of 2017, and you were personally responsible for delivering key actions for health, which were discussed at EPSCO. This would have undoubtedly required intersectoral and multi-country collaboration, and these are highlighted in the SDG roadmap as key strategic directions for SDG implementation. So we would be really interested to hear in your experience and why this was key to your success in Malta's presidency.
Thank you, Luciane. Thank you very much. I've been asked to keep this for 4 minutes, so I'll do my best to stick to the time. Actually, what I'd like to do is to link your question with what the regional director just spoke about with regard to the roadmap for the SDGs. And undoubtedly, one of the most important goals of the 2030 program is the question of universal healthcare. Now, across regions, that will mean different things for different countries. But again, even within the European region, there is a vast difference in what this means. Yesterday's report by the RDs showed us, for instance, there is a vast difference in the level of vaccination, even between countries within the same WHO European region. So again, universal healthcare will mean different things in different places around the globe. But for a lot of us, certainly, there are two key issues when it comes to universal healthcare. And these were issues that You mentioned the Maltese presidency we discussed, and I think with a certain amount of success. The first is the access to new medicines, to innovative medicines, to, I'm afraid, highly prized new medicines, and this is something which we discuss, and I will spend a minute talking about. And the other thing is the access for patients for specialized healthcare, especially with rare diseases. We have a situation in Europe, not just for rare diseases, but especially so for rare diseases. We have a situation where people in different parts of Europe with the same disease get different levels of treatment. Now, within the EU, that is probably illegal, seeing the cross-border healthcare directive, but it is certainly immoral to have people with the same condition being treated differently or being treated to a different extent just because they happen to live in different parts of the continent. So we really believe, and I think this is something which we need to bring in to the SDGs, that there has to be collaboration between centers of excellence who can provide high-level care, especially for the rare diseases, across our continent. And this is something which, together with the Commission, we launched during our presidency last March. The European reference networks are a step in this direction, whereby a number of highly specialized centers across Europe are linking and will be offering opportunities for research, opportunities for service provision, opportunities for best practices, and also, we believe, should offer opportunities for training. Because one of the problems with rare diseases is that people who have them often struggle to find the right physician to treat them. So this is one of the things we need to look at, cross-border collaboration when it comes to treating and to providing highly specialized health services. The other thing I mentioned was the access to innovative medicine. Now, what is happening in the pharmaceutical industry, and I have to make this clear, we have to work with the pharmaceutical industry. I know some of us would rather that there was a different model, whereby medicines come onto the market and whereby medicines are procured. But the fact is that there's a pharmaceutical industry, and we need to work with it. Now, what is happening in the pharmaceutical industry is that more and more, the industry is merging. When I was what Lucienne didn't tell you is that Lucienne and I were colleagues at university, and she's a dear friend of mine. So but when we were at university, a few years ago, Lucienne, I have to say.
A lot of years ago.
There were, I would say, about 50 larger, or the market, the pharmaceutical market was divided between about 50 companies. Now it's less than 10, and they are merging. And as they merge, they are becoming more, they are monopolizing the market. Now, as member states, we cannot merge, of course, and we even strongly believe that healthcare should be a national competence. So we shouldn't, but we need to collaborate. As the pharmaceutical industry gets stronger by merging, we need to again get stronger by collaborating. And this is where the key word here is trust. We all believe, or we are all made to believe by the pharmaceutical industry, that each and every one of us gets the best price. They always tell us, we give you the best price because you are small. Or they might tell someone, we give you the best price because you are big, or because you are such a good negotiator. And we tend to believe this. And of course, it's a lie. We cannot all get the best price. But when we come for joint procurement, then we're a bit wary, because we think that we might have an advantage which we are going to lose if we join it. So trust is a very important word. And and this is by no means the first. The Benelux countries have started to do this, and the Visegrad as well. And what we started to do a few months ago during the Maltese presidency is to have a group of mostly Mediterranean, but also other countries, to work together, to collaborate together, with the aim of starting to get some joint procurement as a bloc. So there's Cyprus, there's Greece, there's Italy, there is Spain, there's Portugal, there's Malta, there is Ireland, and there is Romania. And this is the Valletta group. And the last meeting was in Cyprus 2 months ago, and we are starting to build trust amongst us to be able to negotiate with the pharmaceutical industry on a more even basis. And I think this is very important because one of the major stumbling blocks when it comes to universal access to medicines is price. And unless we manage to find a solution to this, then we will have trouble.
Thank you very much, Minister Fern. So we have now also heard about the importance not only of multi-sectoral collaboration in achieving the SDGs, but also in the importance of trust between countries and multi-country collaboration. I'm getting a lot of signals from the head table that we have not stuck to our 5 minutes each and that we've run out of time. But to conclude, I would really love to have just one key recommendation from each of you on how you see the SDG roadmap assisting you with your work at the country level. So perhaps we can start from Minister Balogh. How do you think the SDG roadmap will assist you in your work? Just 1 minute.
Yes, wieder Deutsch.
Yes, in German once again. My original profession allows me to talk for a long time. I'm originally a preacher, but I'll try to wrap it up in 2 seconds and 2 sentences or so. The checklist is very important to us now. As our President said, yes, the WHO is a world organization where we really receive help to improve our health systems and to look at our system in a mirror image and to look at the weaknesses and strengths. And we also have some international compatibility. And when we have this compatibility, then cooperation is possible. And this also strengthens trust. Now, yes, the SDGs are a powerful tool in our own countries to develop a better system and also to improve things in terms of international cooperation.
Your 1 minute.
Okay, so Claudia Stein is going to enjoy this because I said trust was the important keyword for cross-border collaboration. But for managing to get the better of our finance ministers, I think the word is evidence. So we need to go to our finance ministers with evidence. At the moment, September and October is budget month. So at the moment, most of us are going to our finance ministers and we say we need to bring in this new service. And he says, I'm sorry, I need to keep my numbers correct because I need to report to the European Commission. In an ideal world, it would be the other way around. The finance minister would come to us and he would say, I need to keep my numbers correct. And I would say, sorry, you cannot because I need to bring in a new medical service. But that is where we want to go. We have to be more assertive. But to win this, we need evidence. So we need evidence, and I think the RG mentioned this. One of the roadmap priorities is to gather information and use it correctly.
Absolutely. Ms. Wigzell, your 1 minute.
I agree on numbers and facts. I would like to stress the importance of using the local level and to translate global goals into local goals and into local action. And I know there is an extremely positive energy around the Sustainable Development Goals, and we should use that. It's carried by all stakeholders and by all levels in society and civil society as well. And we should use that and take care of that positive energy in implemented goals, I think.
Thank you very much. Mr. Serkenko.
I think for following and implementation of SDGs is key to have a very well tailored implementation plan, because in most times we know what to do, but we don't know how to do this what. So implementation, collaboration with other countries and international organizations, and what is much more important, to have highly efficient healthcare providers in your country, I think is the key, because we had big troubles with this, as more than 90% of our healthcare providers are private. So countries must have strong counterbalances of highly efficient healthcare providers. Thank you.
So thank you very much to all the panelists for the wonderful contributions. I'm sure that everybody appreciated the experiences that you've had. And I won't try to conclude because it's been so rich. I just like to thank you for being part of this panel. And I will hand over the floor back to the chairperson. Thank you so much. Thank you.
Excellencies, thank you so much for this very interesting and inspiring panel discussion. I think we all enjoyed your interventions, and for us it was also very thoughtful. And now I would like to open the floor for discussion for the member states as well. So I would like to ask you to raise your plates in order to see if you would like to intervene, so you can have your comments about this issue. Yes. Okay, then we will start with the Russian Federation, to be followed by the Republic of Moldova.
President, the Russian Federation supports the roadmap on the implementation of the 2030 Agenda for Sustainable Development, building on the European policy Health 2020 and taking into account the MDGs as well. We support the creation of a united monitoring system on the basis of approaches which were used in the monitoring system Health 2020. We support the creation of an expert group on determining the general indicators for the 3 monitoring structures. We deem it wise that this working group will coordinate its work with the activities of the European Initiative on Health Information, whose mission is to create a unified information system in the European region on the basis of the Moscow Declaration. We also deem it wise to use the gateway that was put forward by the region regarding accountability of European member states and a transfer of data to the WHO and UN headquarters. This decision allows us to reduce the burden on countries and also allows us to harmonize the data. Russia, under the Putin presidency, has created an expert group on SDG monitoring. Russia also actively cooperates with the CIS countries. We have a statistic committee that has SDG indicators. The Russian Federation supports the draft resolution. Thank you.
Thank you very much, Russian Federation, and I give the floor to the Republic of Moldova, followed by Tajikistan.
Thank you very much, Chairman. Chairman, Regional Director, Director General, the Republic of Moldova intends to include the SDGs into its national policy and development programs. We are already working on this, and we have had support from the UN and WHO when it comes to what is related to health. Recently, we had a UN mission on integrating and speeding up the inclusion of the SDGs in the overall process. Health is one of the priority areas which we intend to work on as we pursue our goal of sustainable development. Recently, our government approved tasks and activities to be undertaken directly related to them. We are now looking at our Moldovan Development 2020 strategy, and as a result of that, we will have a further strategy carrying us to 2030. Health will have a priority and central role, and whatever we do in respect of it will be fully in step with WHO's regional policy on Health 2020. The Sustainable Development Goals and the provisions of agreements between the EU and Moldova will also be involved. We intend to adjust and amend our approach to take into account health in all our policy decisions and to ensure that we have a unified approach. We do hope that we will continue to benefit from the support of WHO in this respect, and we'd already like to thank the Regional Director for the support and backing we've had. These issues are a priority at the highest level of the Moldovan government. We are monitoring the process through the relevant government departments, and that will ensure that we have continued official support and, we hope, success achieved not only by us but through cooperation with all our partners. We also have a coordinating council with our partners who are helping us with health-related matters in Moldova, and that will help us to tackle problems as they arise. The chairmanship is held jointly by a WHO representative and somebody from our health ministry. We hope that this will help us to have comprehensive action which will involve all those who need to be involved and ensure that we are acting fully in accordance with our health policy. It will also improve transparency and accountability, and that, we think, will help everyone involved to enjoy their potential in terms of health to the full. Of course, we need to have close interdepartmental and sectoral cooperation if any of this is to be possible, and with that end in mind, we have recently carried out a major restructuring policy in our Health Ministry, Labour Ministry, and Social Protection and Family departments. We will not be able to solve any of the serious problems facing our people unless we have proper intersectoral and interdepartmental cooperation and coordination. We're trying to achieve this in many areas, including antimicrobial resistance, reducing smoking and the abuse of alcohol, and improving our environment. As I say, we have been overhauling and reforming our health system for some time, and we are focusing in particular on strengthening the provision of primary health care, the reform of medical institutions, the restructuring of public health, improving and strengthening the financing of our health system, and making sure that we achieve universal health coverage. We will update and overhaul our SDG agenda as we go, and that being the case, we fully support the plan of action for the achievement of the SDGs and its 5 strategic areas, as well as the 4 factors which have been presented. One of the key documents which helps WHO member states to achieve the SDGs is precisely this, and we hope that if it helps us to achieve the SDGs, it will help us also to achieve universal health coverage to the benefit of our citizens. Thank you.
Thank you very much, and I give the floor to Tajikistan, followed by Austria.
Thank you, Director General, Regional Director, and distinguished members of the meeting. I would first of all like to thank the European Regional Office of WHO for the work it has put into this document on the achieving of the health-related SDGs and the implementation of Agenda 2020 in our countries. This document is particularly topical and relevant for Tajikistan. Together with other countries, we have been working on sustainable development for some time and have a program which will cover it to 2020. We are trying to fully integrate the SDGs into our development policies in Tajikistan and make sure that they are part of official government policy. We have adopted a national development strategy to cover the period up to 2030. and we hope to include the key provisions of the Sustainable Development Agenda therein. These documents are key instruments for helping us to achieve the SDGs and ensure that they're fully included in our health policy. We have already covered about 72% of the SDGs, including things such as road safety, energy, environment, health, infrastructure, etc. But we still have a great deal to do if we are to fully integrate the SDGs into our national policy. We are, of course, working with our sustainable development partners to make further progress. And the Secretary General of the UN and the President of Tajikistan have cooperated together to ensure that we can act in as effective as way possible at all levels, national, regional, and indeed international. Tajikistan will be guided in the future by further coordination and cooperation on the SDGs, and we hope to get civil society and non-governmental organizations more actively and widely involved in working on the achievement of the SDGs as well. We are grateful to WHO and particularly the European Regional Office for the support and assistance it has given to our country in achieving the SDGs and improving the health and well-being of our people. Thank you.
Thank you very much, and I give the floor to Austria, followed by Norway.
Yes, thank you very much, President. Can we suggest that first of all Estonia speaks and then Austria will speak after Estonia? Thank you.
Yes, Estonia, please. The floor is yours.
Thank you, and apologies for jumping the queue like this. Estonia speaks on behalf of EU and its member state. So we welcome the work done by the regional office towards implementing the 2030 agenda, and as already voiced yesterday when responding to the RD's report, we are pleased to note the way how the regional office has incorporated SDGs into country cooperation strategies and the emphasis placed on reducing the reporting burden and avoiding duplications when reporting. The EU and its member states would like to make a small amendment to the resolution that we are discussing. The resolution is in Conf Doc 4, Revision 1. And it is with the aim of strengthening exchange of experience between countries. We would like in operative paragraph 5F to add the words and facilitate exchanges of experiences, including best practice examples, after the words translation. I will read the text out as it would read, and we have submitted the amendment in writing to the Secretariat as well. So the sentence in operative paragraph 5F would read as follows. To promote regional cooperation in science, technology and innovation in order to enhance knowledge sharing and translation, and facilitate exchanges of experiences, including best practice examples, emphasizing the importance of collaboration among countries, sectors, and networking mechanisms, including twinning arrangements, and so forth. Thank you.
Thank you very much, Estonia, and I give the floor to Austria, followed by Norway.
Thank you very much, President. We, of course, endorse the statement made by Estonia on behalf of the EU and its member states, and we also support the various proposals and amendments. We would like to thank the regional director and the regional office for the foresight that has run through the Health 2020 policy framework particularly with regard to the fact that it ties in with the SDGs. Yes, it's very important to mitigate the work for the region. Now, one challenge is, above all, collecting data for the indicators, and in order to be able to measure our policies. Yes, we need to have more proactive coordination between member states in the OECD and also non-state actors as well. This is all vital. Now, in this context, as has already been said by the regional director, the European Health Information Initiative is a special mechanism in Europe to support evidence-based policy shaping. And perhaps we could have a similar mechanism at a global level. Now, here, the data should be used for the relevant areas. Thank you very much.
Vielen Dank, Österreich.
Thank you very much, Austria.
Over to Norway.
Thank you,
Followed
Chair.
by Monaco. Sorry.
Thank you, Chair. We thank the Secretariat for the roadmap to implement the 2030 Agenda. We agree with the principles of the roadmap and the common challenges for health and the need for cross-sectoral approaches to SDGs, Health 2020 and NCDs in the region. We are very pleased with the work done on the joint monitoring framework and the options presented to lessen the burdens of reporting. We appreciate the complexity of reporting at this aggregated level and appreciate the options presented in the document on how to better track progress in a meaningful way for 2030 Agenda, Health 2020 and the NCDs. We believe that option 5, as presented in the information document, will be the best way forward and are ready to assist in the necessary member states' consultation on indicators. Finally, we also support the amendments suggested by Estonia on behalf of the EU.
Thank you, Norway, and I give the floor to Monaco, followed by the Netherlands.
Je vous remercie, Madame.
Thank you, Chairman. Since this is the first time the Monacan delegation is taking the floor, I'd like to thank the Hungarian government for its welcome and its support, and I'd also like to welcome the presence of the new Director General, Dr. Tedros. We are grateful for the preparation of this roadmap and would like to make a couple of specific points on it. As far as coordination between UN agencies is concerned, we have noted the creation of the Thematic European Coalition on Health under the auspices of the Regional Office. Insofar as the first contribution therefrom is scheduled only for 2019, we would like some further general information to be provided to us on this initiative at this stage. Generally speaking, we support the Regional Office to further strengthen interagency coordination to avoid any possible duplication of initiatives. In the chapter on partnerships, the report mentions the Small States Initiative, and I would like to welcome the adoption of this initiative at the third high-level meeting held in the Principality of Monaco some time ago. There was a Monaco declaration called Health in All Policies, Health in the SDGs, and a call to action on climate change. The 10 countries with fewer than 1 million inhabitants in the region committed themselves therein to act jointly nationally and internationally so as to deal with the health challenges inherent in climate change by adopting a really cross-cutting approach. I think the approach taken by the Biology Department of the Monacan Centre has been taken as a lodestar, as it were, and that is something we welcome. On follow-up, we think it is essential to avoid the increasing burden of reporting on member states. We think that what is proposed may be a good solution, but it will be a good idea to remain vigilant so as to, again, not have any overlapping or duplication with or between the general UN system. We think that the 3 levels of WHO should work in coordination and cooperation, and WHO should also cooperate in a similar way with other agencies within the UN system to have access to the necessary data. To conclude on follow-up, let me just say that in July last year, Monaco agreed to a voluntary review at the high-level policy forum. Thank you.
Thank you very much, Monaco, and I give the floor to the Netherlands, followed by Switzerland.
Thank you, Chair. The Netherlands aligns itself with the statement made by Estonia on behalf of the EU and its member states. Solid health information is of vital importance for policy making. Yet, member states have to meet many data delivery requests, which may be challenging. The Regional Office for Europe acknowledges this and has started the initiative to develop a joint monitoring framework aimed at reducing the reporting burden for member states. We endorse this initiative and welcome the document with options for reducing the reporting burden on member states and proposal for a joint monitoring framework. At the same time, we see that the further elaboration of the joint monitoring framework will still require considerable effort. In our opinion, an important point of attention will be that making sure that the reporting burden for member states will really reduce will require looking beyond harmonizing indicator definitions. The underlying data collection and reporting mechanisms do also need to be taken into account. In addition, extensive coordination with various stakeholders, such as WHO headquarters, UN Stats, the European Commission, and the OECD, will be necessary. The Netherlands, acknowledging the added value of a reduced reporting burden and more efficiently produced health intelligence, is willing to actively contribute to this further development process. Therefore, we would be pleased to nominate an expert for the suggested expert group. Thank you.
Thank you very much, and I give the floor to Switzerland, followed by Finland.
Thank you, Regional Director, Chairman, ladies and gentlemen. Switzerland is grateful to the Secretariat for the roadmap to implement the 2030 Agenda for Sustainable Development and the associated draft resolution. As far as the strategic direction and the messages envisaged are concerned, we consider those to be relevant. We support the emphasis which has been placed on the determinants of health and on health capacities. These are two subjects which are at the heart of our own concerns. As a support to the carrying out of activities in this area, it would, we think, be useful if WHO were to develop more specific guidance and lines for action, particularly in respect of intersectoral cooperation. Furthermore, we would particularly like to take this opportunity to express our appreciation for the efforts which have been made in order to develop a joint monitoring framework for the WHO European region. Questions of evaluation and monitoring of the implementation of the 2030 Agenda are, of course, essential. Switzerland has been very much involved in these issues at international level, particularly as part of the high-level political forum. However, it's equally important not to swamp countries with requests related to the monitoring of carrying out activities. Streamlining efforts in this respect would be particularly welcome. In the joint monitoring framework, we would like to emphasize the need to define specific, measurable indicators in respect of governance, equity, and health capacity and skills. On this last point, we agree with the points which were made in the statement delivered on behalf of the German-speaking countries of the WHO European region. In conclusion, in the next General Work Programme produced by WHO, we think it would be important to underscore how the organization will contribute to the achievement of the Sustainable Development Goals, based on further efforts at alignment and implementation similar to those which have already begun to be taken in other WHO regions and countries. Last but not least, Switzerland supports the draft resolution. Thank you.
Vielen Dank an die Schweiz, and I now give the floor to Finland, followed by Albania.
Thank you, Chair. Finland aligns itself with its statement of EU. The Agenda 2030 brought about what we have been working on 20 years. It recognizes explicitly health as an integral component of the sustainable development. For us, responsible for the health and well-being of our population, this is a challenge, but also an opportunity not to be lost. We member states must ensure that health targets of the Agenda 2030 are appropriately embedded in our national implementation plans, safeguarding no one is left behind. In this regard, the European region is well advanced. Building on the Health 2020 framework, the new roadmap will enable the regional office to concentrate on supporting and guiding the member states. The integrity and comprehensive nature of the Agenda 2030 creates also a momentum for breaking health out of isolation by expanding the links with other sectors and actors. Taking advantage of existing networks and creating new partnerships is crucial. A good example is the new coalition of partners launched by the regional office to implement the European Action Plan for Public Health. The coalition, which will meet next time in Helsinki in November, will support putting in place essential public health functions. Essential public health functions, together with appropriate social protection, are indispensable to genuinely guarantee universal health coverage. With the aim of ensuring access to high-quality health services, continuing to provide effective population-level health protection and promotion, while guaranteeing sustainable funding, Finland is currently introducing a major health and social service reform. In this work, we have received valuable guidance from regional office. To conclude, we need to develop the business case for health beyond its recognition as a cost to societies. In line with our European Health 2020 framework, health is value, a resource and a goal for our societies, justifiably maintained, protected and promoted. Thank you.
Thank you, Finland, and I give the floor to Albania, followed by Italy.
Thank you, Honorable Chair. Honorable General Director Dr. Tedros, Honorable Dr. Susanna Jacob, distinguished ministers and heads of delegations, ladies and gentlemen. The Albanian delegation wishes to commend WHO Regional Office for Europe for preparing and timely sharing the roadmap to implement the 2030 Agenda for Sustainable Development, building on Health 2020. This is a consolidated and well-grounded document that builds on the achievements across all the European region and attempts to take into account the specificities of the region. Coming to country specificities, Albania is fully committed to the Agenda for Sustainable Development 2030, while pursuing also the EU integration agenda. A process is initiated in the country, looking at the government's and other stakeholders' efforts on SDG mainstreaming in search of common ground between the SDGs and the EU integration and assessing forward-looking approach. Critical steps have been undertaken to push the Agenda 2030 forward. This includes the establishment of national coordination mechanisms, the Interministerial Committee on SDGs, and the Interministerial Working Group on SDGs. The rapid integrated assessment has been completed. The baseline report on SDGs is being consulted with stakeholders. With regard to the status of health-related SDG targets at the country level, 12 SDG 3 targets are aligned, and one is partially aligned with national policies in Albania. With regard to the availability of SDG 3 global indicators in Albania, 17 are readily available, 4 are partially available, 5 are not available, and 1 is not applicable. The process continues with drafting of the National Action Plan with key directions for SDG mainstreaming over the next 2 years. Albania urged WHO to accelerate the work for providing a core package of SDG-related technical resources, knowledge, and tools. The joint monitoring framework for the SDGs, Health 2020, and the Global Action Plan for the Prevention and Control of Non-Communicable Diseases, 2013-2020, is an expression of the WHO strategic coherence and proof of the improved accountability of the organization. Albania fully supports the draft resolution roadmap to implement the 2013 Agenda for Sustainable Development, building on Health 2020, the European Policy for Health and Well-being. Finally, I use this opportunity to express my gratitude to WHO Euro and WHO Office in Albania for their valuable support in the SDG mapping exercise completed during the drafting of the National Health Strategy 2016-2020. Thank you for your attention.
Thank you very much, Albania, and I give the floor to Italy, which is the last member state on my list. If other member states wishing to speak on this agenda item, please raise your nameplates. Italy, you have the floor.
Thank you, Chair. Can you hear me? Is it working? Okay, good. Thank you. Italy aligns itself with the Estonian statement on behalf of the European Union member states. We are very happy with the credible and convincing document generated by consultation of member states and WHO. In particular, we note the emphasis put on a few crucial issues. Protecting our societies against major emerging public health threats. This is an area that must be expanded and detailed very carefully, as we need to explore and get ready for the unexpected. Strengthening our capacity to forecast is essential to anticipate action and prevent and mitigate impacts on the most vulnerable sectors of our societies. Integrating social and health services in a continuum of care by which governments take a responsibility and invest in the youngsters, tomorrow's adults, without forgetting the aging part of our societies, which is becoming larger and more demanding than ever. We are convinced that we are accountable first and foremost to the weak and vulnerable individuals and communities, all too often almost invisible to the traditional organization of health services. Tracking proactively disadvantaged population groups and the individuals, providing them with a range of services they need and are too peripheral to the system, even to make their voice loud enough to be considered. Overcoming the artificial and mechanistic silos organization of our government structures, making them more relevant to evolving society's needs and requirements. Our national health information system is in fact being reshaped to include data disaggregation to the level needed to monitor inclusion and proaction. Expanding the network of our social and health services to include migrants and populations on the move. We were a country of migration, and we cannot forget the 60 million Italian passport holders around the world that matched the number of residents. We know by experience that integration is a challenge that we cannot solve in few years. The agenda presented by the RD provides us not only with a framework for implementation, but also with a clear set of action-oriented tools. By adopting them, we will feel stronger and better placed to advocate for health at the center of national political agendas and at the center of government and society investments in knowledge and development, to reform systematically our system, making it adaptable, resilient, equitable, capable to absorb research and innovation outputs and reaching those who are most in need. As we already said, being Italy one of the last surviving government-funded universalistic health systems, we have achieved a lot, but we are still fragile, as Prime Minister Tsipras clearly stated. We have established a standing committee to work on promoting and monitoring the alignment of government activity with the SDGs. It is chaired by the Prime Minister's Cabinet, and the health sector is one of the leading entities. However, we feel we can be overcome at any time by economic crisis, by budget cuts, by persisting inequities, by forgetting our legacy of solidarity and integration, by incumbent challenges due to climate change, environmental degradation, natural disasters, conflicts, and turmoil. Working together with the strong leadership of WHO will provide us with solid tools to react also to market-for-profit forces when they work at the detriment of the health sector and its perspectives and objectives as included in the SDG broad agenda. Italy endorses the roadmap and commits itself to its full implementation, working hand in hand with the regional office as indicated in the new country cooperation strategy that we are going to sign tomorrow with the DG and RD. Thank you.
Thank you very much, Italy, and I give the floor to Germany.
Thank you, Madam Chair. Sehr geehrte Frau Regionaldirektorin, sehr geehrte Ministerin, sehr geehrte Damen und Herren, Deutschland unterstützt.
Thank you very much, Regional Director, Ministers, ladies and gentlemen. So we fully support the statement made by the EU. Health for all is one of the most effective principles of the 2030 Agenda, which is absolutely fundamental. It's very important that nobody should be deprived of basic health care. In Germany, from the beginning of this year, we have come up with a new sustainable strategy together with the collaboration of all ministries and under the leadership of the Chancellor. This goes along the lines of Sustainable Development Goals to the year 2030, and it states exactly how the ministers are supposed to implement the Sustainable Development Programme with collaboration within the government and collaborating with the civil society, the economy and science. The follow-up to this process is absolutely a priority for us. There is a state committee that is intended to implement this strategy. Health is part and parcel of this whole sustainable development strategy, and one of the priorities is sustainable objective 3. And over the last 3 years, we have strengthened health training in schools, in kindergartens, in communes, and this through the collaboration of ensuring health promotion and labor protection. We have also developed insurance programs, campaigns for healthy nutrition, fighting against tobacco, and also the importance of an active lifestyle. We talked yesterday about the protocol on the illicit tobacco products, and we have ratified the protocol in July. So we have started the whole process. So this should be concluded later on in the year. In September, we have elections, as you know, in Germany. So we're in a kind of transition phase, but this process, it has our full support. Now, when it comes to the matters of the implementation of the SDGs internationally, we welcome the efforts that are made, in particular, in order to reduce the burden on providing data by countries. And in conclusion, I want to draw your attention to the strategic aspect, the implementation of the SDGs for health, and this should be considered by us and by the WHO as a genuine opportunity for us, and it should help all the stakeholders involved in international health policies to participate actively. We are participating actively ourselves in the WHO, and the role of health is a kind of leitmotif of the general program of work for the coming few years. This approach of sustainable development has an impact on the daily work of the Secretariat of the WHO as well. And in fact, this may enable us to ensure the approach when it comes to the silo approach, and I think we should continue indeed to collaborate on this very important matter. Thank you.
Vielen Dank, Deutschland.
Thank you, Germany.
Then I would propose that we interrupt our discussion on this agenda item and that we continue our debate this afternoon on this topic. We have a few minutes left before we will break for lunch. Therefore, I propose that we will come now now continue our discussion on agenda item 4, the report of the 24th Standing Committee of the Regional Committee. The relevant documents are EUR/RC67/4Rev1, EUR/RC67/4Rev1 Addendum 1, and EUR/RC67/Conference Doc 2 Rev 1. Yesterday you agreed that we could submit the chair's statement in written. You received this, and I now would like to ask, are there any questions or comments on this report? I see none. We can now consider the adoption of the proposed resolution, which is contained in EUR/RC67/Conf.Doc2 Rev 1, report of the 24th Standing Committee of the Regional Committee. Is the committee willing to adopt the proposed draft resolution by consensus? I see no objections. Then the resolution is therefore adopted. Thank you very much. We will now break for lunch and shall resume our deliberations on this item at 2:30 p.m. I should like to remind you that the lunch for ministers or heads of delegations will take place immediately after this session in room Arcade. The topic for the lunch session will be on mental health. Interpretation will be provided in all 4 languages. I remind you that this lunch is for heads of delegations only. Other delegations may wish to attend the technical briefing on ensuring positive outcomes for health at the country level, which will start at 1 p.m. in room Bartok. Lunch for delegates will be served in the mirror corridor. Hostesses will help your orientation, and signs will also show the places. Please leave your headphones on your desk. You will find the necessary equipment in the rooms. Enjoy your lunch and see you here again at 2:30 p.m. We will now continue with agenda item 5A, Roadmap for the implementation of the 2030 Agenda for Sustainable Development, building on the Health 2020 policy framework. Before we resume our debate and continue listening to the delegations who might ask for the floor, I would like to welcome Professor Recep Akta, Deputy Prime Minister of Turkey, who will provide his experience on the implementation of the SDG. Professor Akta, you have the floor.
Thank you, Madam Chairman, Mr. Director General, Madam Regional Director, Excellencies, distinguished delegates. It is a privilege and honor for me to address this distinguished group of people who serve for human health. I thank Zsuzsanna for her kind invitation, Hungarian government for hosting such an important event in Budapest. Health is one of the unique areas which needs contribution from various policy domains and sectors. In order to successfully implement our health plans, we have to adopt a multi-sectoral approach. Strong leadership and full support from other government bodies are of utmost importance for this kind of approach. We have implemented the Health Transformation Program in Turkey in line with this perspective since 2002. The success of our Health Transformation Program has depended on a number of concomitant radical initiatives. This had been a complete stewardship approach, including provision of health care and financing. We have restructured the health system of Turkey with a special focus on efficiency and accessibility of healthcare services. Although there has not been a structured mechanism for multi-sectoral approach during HTP, our government's main pillar has always been a human-centered perspective. Hence, we have benefited much from the activities of other ministries, touching many aspects of social determinants of health, and HTP has created a success story. We have accomplished globally acknowledged outstanding results in health indicators. I would like to emphasize that we have achieved these sustainable outcomes with a substantially low cost to the government, while also minimizing catastrophic health expenditure. The offered comprehensive healthcare services have been achieved without drastically increasing costs, as we kept total healthcare spend at 5.4% of the GDP. Citizens have been provided with financial, physical, and social access to healthcare. Patient satisfaction had been doubled and reached a level of 76% in 2011, which was previously 39% in 2002. Substantial improvements have been achieved in key healthcare metrics in a short time. For instance, the WHO estimated that our life expectancy at birth would be 75 years in 2025. This target was exceeded in 2015 with 78 years. As you know, maternal mortality ratio was one of the health-related MDGs' main indicators. The WHO previously estimated that Turkey would manage to lower this rate to 25 in 2025. Turkey had already gone far beyond this goal before the MDG deadline. Turkey managed to increase life expectancy at birth 5.5 years in only 13 years. Such impressive improvement was achieved in maternal mortality ratio as well. This is the global position of Turkey compared to country income groups in terms of life expectancy and maternal mortality ratio. Considering that Turkey is an upper middle income country, our achievements have moved Turkey beyond its league. We have also used our financial resources wisely. This graph by OECD demonstrates that the change in life expectancy and health spending comparatively. As you see here, Turkey has achieved a significant rise in life expectancy with minimum increase in health spending. I would like to mention two Lancet articles, both of which include comments on Turkey's HTP. The first one was published in 2013 and emphasized that after 30 years of slow progress, since 2003, Turkey has been able to design and implement wide-ranging health system reforms to achieve universal health coverage that substantially reduced inequities in health financing, health service access, and outcomes. Another recent article, also published in Lancet in May 2017, benchmarks healthcare access and quality level in various countries based on a global burden of disease study and measures the difference between 1990 and 2015. Turkey is one of the 5 countries that had the largest increase in healthcare access and quality index. You may know the famous saying, "We are the victims of our success." Every achievement in health system reforms produces new expectations and goals and new needs. In this regard, the second phase of the HTP in Turkey will focus on sustainability and quality of care as further steps. At the moment, as I mentioned before, Turkey spends only 5.4% of its GDP on health. Universal health coverage is already in place and citizens are financially protected to a great extent. Out-of-pocket payments are minimized and catastrophic health expenditures are reduced almost 1/3. However, there is still some room for improvement. Although we decreased our burden of diseases by 4% during the first phase of our our HTP, we are aware that we have a high potential risk of NCDs. 1/3 of our population is obese, and another 1/3 is overweight. Yet 72% of the adults do not perform enough physical activity and live sedentarily. For the second phase of the HTP, health promotion and encouraging change of lifestyle in public will be priority areas. Distinguished delegates, in order to establish a structured mechanism for managing the multi-sectoral nature of health policy, we prepared a program for improving multi-sectoral health responsibility. It was a long process, started in August 2009. More than 1,300 professionals contributed to the process from all stakeholders, including NGOs and academia. This preparation process resulted in hundreds of pages of documents that consisted of policies under 12 main categories of prevention and promotion of health. This program was adopted through a Prime Ministerial Circular in 2014, improving the status of health as a policy area that exceeds the limits of healthcare policy. The main objective of the program is defining the roles and responsibilities of all stakeholders and establishing a national high-level political platform for managing it at the highest level. The high-level political platform is chaired by the Prime Minister, and the board consists of all stakeholder ministries that are supposed to meet once in a year. Please do not ask me how many times we have managed to meet until now. That is the issue. I would like to emphasize that it is usually not sufficient to have a good mechanism on papers. Strong leadership and well-prepared action plans with clear goals and key performance indicators, of course, are crucial. These action plans should first be adopted by the central governments. Second, these strong and operational delivery units at the prime ministerial level should be established to monitor the processes and provide reports. Nowadays, we are preparing that kind of delivery unit. During this stage, it may be needed to create a new mindset for all stakeholders. What I mean here is that change management is critical for all stakeholders, especially politicians and bureaucrats. Ministry of Health should be the leading force for the task, and it should be supported through effective communication with the public, since citizens are generally interested in the delivery of services. Public communication is important for managing their perceptions as well. It is essential to use regional and global framework as a leverage to promote national health agendas and convince the general public and the government. The FCTC is a good example, excellent example, through which Turkey has benefited a lot from the WHO's political support during our success in fulfilling empowered requirements in our fight against tobacco use. I believe similar initiatives with clear guidance from WHO should be prepared for other actual health threats, such as obesity and lack of physical activity, as strong as what we achieved for tobacco control. Putting health at the center of our agenda. It is an excellent idea of WHO. And analyzing its relation with other SDGs is a very good idea. However, this effort would be useless if not accepted and fully digested by the governments and other stakeholders. In order to put this idea into practice, I believe that the WHO should focus on working with the heads of states, prime ministers, and presidents. This would allow the WHO to support health ministers in their leadership role. In other words, we should focus on empowering health ministers. As a final note, Health 2020 and roadmap to implement the 2030 Agenda for Sustainable Development as document setting the scheme for improvements in health, development, and peace are valuable guides for all of us universal, integrated, interdependent, and indivisible nature of the SDGs presents an opportunity to improve health and well-being of all the people and regarding all the determinants of health. The WHO Euro is well positioned to implement the 2030 Sustainable Development Agenda, thanks in large part to the Health 2020 policy framework, which has been a pioneer in documenting the interrelation of health, well-being and development, and advocating for the whole of society and whole of government approaches. We should continue to work together to make the implementation of SDGs another success story and keep the pioneer role of the WHO Euro with supporting each other in solidarity. Thank you.
Thank you very much for sharing your interesting experience with us, Deputy Prime Minister Professor Akta. There are many good examples on how the Agenda 2030 can be implemented, and many of you have started doing so. There are also many different ways in operating on common actions, such as governance for health and well-being, the promotion of multi-sectoral action, partnership, accountability and financing. I would like to hand over to Dr. Kökeni, who is our moderator this afternoon, to introduce the panel.
So good afternoon, Excellencies, Director General, Regional Director, ladies and gentlemen, Madam Chair. This afternoon will be devoted to the stakeholders. We are going to listen to the voice and approaches of very different type of organizations. We have, first of all, a representative of a sub-regional, an inter-country network, which is the Southeastern European Health Network, Mira Jovanovski, the head of the secretariat of this network. We also have a representative from a sub-national network, a regional for health network, Mr. Peter Beznitz. And then we also have a representative of the famous Healthy Cities movement, Ms. Joanne Devlin, who is the Chief Executive of Healthy City Belfast from the UK, and also she is the head of the Secretariat of the Healthy Cities. And last but not at least, we also have an umbrella organization of public health-related NGOs, the European Public Health Association. So without any further delays, we have heard from the regional director this morning that the multi-partner cooperation is one of the enablers of implementing sustainable development goals. So could I turn first to Mira? So you are now the new head of the Secretariat of the Southeastern Europe Health Network. And could I just ask that how do you foresee the use, the here discussed SDG roadmap in your network? So what do you think?
Thank you for giving me the opportunity to share with you Southeastern European Health Network messages related to the roadmap for implementation the Sustainable Development Goals in our sub-region. The fourth Ministerial Forum, Health, Well-being and Prosperity in Southeastern Europe, by 2030 in the context of the 2030 Agenda for Sustainable Development held in Chisinau, Republic of Moldova, in April 2017 was strongly focused on the Sustainable Development Goals. The outcome document, the Chisinau Pledge, set up our strategic directions towards the implementing of the Sustainable Development Goals 2030. It will be operationalized throughout the development of the Southeastern European Health Network Sustainable Development Goal Roadmap. World Health Organization instruments, including the SDGs roadmap, will present a valuable and inspirational tool and guidance to this end. I wish to emphasize that the Southeastern European Health Network activities have been focused on Health 2020 implementation from 2012 onwards. Thus, our member states are not starting from the scratch. All of them have national health policies aligned with Health 2020 in full implementation. The Sustainable Development Goal Roadmap will actually present our implementing tool for the Chisinau Pledge and the continuation of the good work. We are thankful to the World Health Organization for its long-standing and strong support to our action. We are stronger together. I would like to share an example of impact from the Southeastern European Health Network action on the reforms for health in the member states. The Southeastern European Health Network program for strengthening community mental health had led towards mental health reforms in all the member states where mental health centers had been opened and standard setting and capacity building done. This action had significantly contributed to improving mental health in the Southeastern European Health Network member states. Global and World Health Organization standards and instruments have been implemented. However, there are many other examples in the area of tobacco control, communicable diseases, etc. Southeastern European Health Network will continue to employ actions which had proven successful on the way towards achieving sustainable development goals. Within the roadmap for implementing the Chisinau Pledge on the road to sustainable development goals, we plan to invest specifically in health policies development and strengthening health information systems, as good data is essential for tracking process on sustainable development goals. This was the conclusion of our technical experts that have just finished the meeting of the regional health development centers of the Southeastern European Health Network. We plan to strengthen the regional health development centers in terms of health policy and health information to support sustainable development goals implementation. We will continue working with World Health Organization on this, as well as with other partners which are interested to support these developments.
Thank you very much indeed, and it is interesting, to emphasize that you mentioned community mental health as an example. And I think it's really very important in a sub-region which has suffered so much earlier because of the armed conflicts. And that's a very, very interesting development from your network. But let me turn to Peter. And as you are part of the Regions for Health network, and can you tell us also at least one practical example of how the roadmap can be applied to Regions for Health?
Thank you. Thank you for the question. Yeah, and thank you for the opportunity to share some of our thoughts also from the regional perspective. Well, in practice, we think, we can also see that this roadmap is already being implemented by the regions and even more maybe by the local communities. A lot of work has already been done to achieve the Sustainable Development Goals, but they are maybe not necessarily recognized as such, or they are not measured. As an example, I can give you some of the work that we did in our region, but I'm sure you can find it throughout the European region. I come from Primorje in Slovenia, which was one of the most underdeveloped regions and with the worst health indicators in the country. And by linking this regional health inequalities actually with the regional development process, we actually paved the way to introduce intersectoral cooperation on health determinants on both on the national and on the regional level. In this process, we were looking for development areas in which we could improve the living and working conditions, but also improve health of the population at the same time. So I will share some of these areas with you, and being a rural region, the first, of course, such area identified was agriculture. More specifically, it was the sustainable food production, consumption, and distribution. The aim was to increase the local demand for such food, and we did with the promotion of healthy and balanced diet, especially in public institutions such as schools and kindergartens. And also we wanted to reconnect the local supply with the local demand. And this was the easiest way to do it was through the short food supply chains and through the development of the local food markets. Another such area was tourism. It was very well established industry in the region at the time, but it was maybe too much focused, or let's say limited to the spas and hotels. So we decided to develop healthy tourist programs, healthy tourist projects to provide tourists, but also the local population with the infrastructure and guidance on how to use the outdoor, how to be more active outdoors, like hiking, biking, and Nordic walking. This was also done with the connection to cultural and natural heritage that we have in the region, which brings us to the third area, which is environment. This included environmental protection actions and reducing air pollution by promoting active mobility, non-motorized transport, and daily commuting. And finally, of course, we invested very much in health promotion and social inclusion through community social activation and active and healthy aging programs. All this investment we hoped for to achieve multiple benefits, of course. The first target was, of course, health of the population, but also we wanted to create sustainable jobs, we wanted to improve living and working conditions, improve environment, and also save on public spending in the long term, which is all, I think, all these outcomes are aligned with the SDGs, and they have also support from the national level, because Slovenia's Vision 2050 and also the new National Development Strategy are both based actually on the Agenda 2030.
Thank you very much, Peter. So I think it's important that in this process you focus really on the various determinants of health and not definitely just the health system or health in general. So, I mean, let me now move to the cities. We have John from the UK, from Belfast. And then we have learned that Healthy City is a city that is sustainable. But how can the Healthy Cities Network best contribute to advance the 2030 agenda? So what do you think?
Thank you, and thank you for the opportunity to be here. Many of you will be familiar with Healthy Cities. It was established in 1988. We celebrate our 30 years next year with an international conference in our city. But it was established on 3 key principles which reflect the Sustainable Development Goals: inequalities in health, community participation, and intersectoral working. And I think key to the success of the Healthy Cities movement across Europe has been that it's a politically driven network. The mayors of the city drive the healthy city at the local level, part of the sustainability of the network. We've had a vital partnership with WHO in terms of technical support and working with us in small groups on issues like gender, healthy ageing, healthy urban planning. And we've been able to share with each other, the cities across the network, innovative solutions to some of the key challenges we've had. We've largely worked on the determinants of health, engaging other sectors. And we think that the Sustainable Development Goals offer a framework to revitalise healthy cities at the local level. But it's essential that national governments provide local government with the support to be able to work intersectorally and at the multi-governance level. So it's governance across sectors, but also at the multi-level. And if I could maybe just give you one example, it is a challenge, but one example recently has been, like a number of other cities, we've had an increase in mental health issues and suicide among young people. And in an area that we're working in, that's really an area of high deprivation, the population do not have access to private cars. There are good mental health services, but they're not based in the locality of the city. There are no public transport routes in that area either. So for young people to access the mental health services, they need to take private taxis, and a lot of them cannot afford that. Transport policy is delivered at the regional level. So we've had to work at the regional level and with other sectors to be able to access mental health services for young people in that area. So I think it's a good example of working across sectors, but also at the multi-governance level. Another example might be, and again, lots of cities have very good experience in this, but the concept of place has a significant impact on health and well-being. And we've recently produced an excellent teaching resource. And again, it's a tool that has been used by other cities in the network. We've engaged the health sector, the housing sector, and the planning sector. The children develop a proposal to identify what they want to improve within their local built environment. And then the planners come in to support them to be able to make change in that local environment. It's still a challenge. Intersectoral working is not easy. We all speak different languages, and I think that's one of the key areas with which the Sustainable Development Goals and at a national level we can be supported. We need to understand the language of other sectors, and we need to be able to provide them with the evidence that will change their policies to be able to address inequalities and improve health at the local level.
Thank you very much. And then I don't know whether you have noted that there was no previous discussion that who is going to talk about what. And it's interesting, to note that Joanne is the second in this small panel who is suggesting to focus on mental health issues. And she was mentioning about the access to the mental health services. So I've just a small note. Nina, you are the Secretary General of the European Public Health Alliance. So how do you see how the SDGs can be achieved through public health strengthening?
Thank you very much, and thank you for the invitation to join you this afternoon. It's a great privilege for the Alliance to be here and to be able to speak to all of you and exchange with you. I think I want to answer your question firstly by saying what not to do. So something to come off the to-do list, possibly as a useful approach. I think when it comes to non-communicable diseases, after 10 years of trying self-regulatory approaches, so voluntary measures undertaken by the producers of unhealthy products, I think it's time to draw a line under that, say we've tried, these aren't evidence-based, and by and large, when it comes to NCDs, obesity, reduction of alcohol-related harm, these have failed to deliver what we expected. We expect, when it comes to antimicrobial resistance, voluntary measures, self-regulation isn't going to cut it. These are too serious a problem now. The evidence base is there to say, okay, we need to move on to the indicated set of best buys, which are evidence-based, and we know a great value for money, including pricing and fiscal measures that were mentioned by the regional director specifically this morning. If we're going to meet our national targets, your targets for 2025 and 2030, we need to move on away from self-regulation to genuine measures that we know will work. For that to happen, there's another thing on the no longer to-do list, possibly, not least in the countries of the EU. We need to dismantle the barriers that we find in legislation and other policy areas which are hindering you from doing what you want to do. So policies which are incoherent with our goals, protectionist of the commercial determinants at the expense of our health. For example, health harmful subsidies, of which there are a great many examples, not least again at the European Union level. So it would be very, very useful for us to collectively draw up, inventorize and impact assess the health harmful legislation, identify those barriers that are going to need to be dismantled very, very quickly if we're to have a hope of tackling the issues that we're faced with. It is absolutely essential that we create supportive economic policy and governance environments. And I think we're well on our way. There's a lot to be, on a positive note, very, very excited about. The investment case, I'm very, very glad that the roadmap puts emphasis on investment for public health. The investment case is something to get really, really excited about. We're at a point now where I think we're in a tipping point where we can turn the vicious circle that we've been in for a long time into reverse. I'll just give you a few key figures about the investment case, particularly for public health. The projected costs that we need to invest to reach the SDGs are 3.9 trillion. But if you put this in the costs of per person per year, we're looking at $58 per person per year to 2030. This sounds a lot more feasible. The business investment community is excited. The Business and Sustainable Development Commission found that there would be returns to the private sector in realizing the SDGs of $12 trillion. This suggests that meeting our SDG targets will pay for themselves 4 times over. Even more than that, public health measures in particular, so the preventative measures that we're all talking about and that you're implementing, a recent meta-study in the British Medical Journal found a rate of return of an absolutely stunning 14 to 1. Every euro, every dollar invested in public health preventative measures pays back 14 times over. So there's a huge amount we can do, and I believe what the public health community can still tap into is working with the growing group of ethical and responsible investors. And these guys have really been game changers when it came to opening the way for climate action policies. And I think we can do the same again here. We're talking about unlocking new sources of investment, not asking our health ministers to grab a bigger share of the budget, not asking a bigger share of the budget to be diverted to public health measures, but tapping brand new sources of additional financing that can help us all realize what we're aiming for. We're talking about prevention of NCDs, curbing antimicrobial resistance, but also exploring new models of drug development. The last thing I want to say is really about the role of civil society. As I said, we're hugely privileged and we're very, very happy to be here. You will have all seen that there was a number of statements drafted by the civil society organizations that are represented. Please take that as a signal of our goodwill, and we're here with you. We can be supportive in any way that we can, both to the member states and the WHO. Thank you.
Okay, thank you very much. Unfortunately, the time is really running very quickly. So all of you have just one sentence to say, really one sentence, as takeaway message, really, you know, what should be done to put SDGs right on the path. So, okay, who is going to start with that one sentence, please, not more. Ira?
Okay, thank you. I would wish to conclude with a call for strengthening partnerships for sustainable development goal implementation, which is essential if we are to achieve the sustainable development goals. And the Southeastern European Health Network acknowledges the strong leadership role and extensive support of the World Health Organization in creating and sustaining partnership for sustainable development goals. Thank you very much.
Okay, thank you. Nina, your sentence.
Sure. I suppose to summarize the messages, we can't afford not to act. You've all seen the figures, the $100 trillion of GDP that AMR is projected to cost by 2050 if we do nothing. Let's start talking to investors, let's understand how they work, and let's help them to understand that AMR, obesity, NCDs are a massive, massive risk to their investment and get them on our side.
Okay, so you want to have more and more evidences. Okay, Peter, please.
Okay, one sentence. Let's talk more with each other. Let's communicate, not only vertically, but let's communicate also horizontally. Let's share the knowledge, the experience with each other, because this is not some competitive business. This is a global movement, and we are all in the same boat. And I hope that we can do this also through our networks that are present here and many other networks that are throughout Europe.
Thank you. Communicate, communicate, communicate.
Yeah.
And last but not least, Johan.
Perhaps it's a reflection of all three. It's about learning the language of other sectors to be able to communicate with them, providing them with the data and the local data. I think often we have national and regional data, but not local data that disguises inequalities. Providing sectors with the data and evidence to ensure their policies improve health and address inequalities.
Really, thank you very much. In 30 minutes, there has been a lot what we have heard. Good advices, really good advices. But I have to tell you that in spite of the enthusiasms of the various sectors in terms of this ambitious agenda we have just heard, I'm afraid that the implementation seems to be tough. Very tough. So a lot to learn that we have heard how. I would like to thank for the panelists, really they were wonderful, and leave you with just a quotation from Mark Twain, who used to say that even if you are on the right track, you will get run over if you just sit there. So thank you very much.
Thank you very much for sharing your views. Without the support of our partners in the countries and in networks, we will not be able to achieve the SDGs. So this is very important for us. We will now continue our deliberations, and many member states took the floor before we broke for lunch. If there are any additional member states wishing to speak, please raise your nameplates. I see none. Then I would like to give the floor to observers. And I would like now to invite Mr. Aykan Rahimov, Deputy Director of the International Federation of Red Cross and Red Crescent, to take the floor. Mr. Aykan Rahimov, you have the floor.
Ms. Chairman, dear representatives of Member States and partners organizations, distinguished ladies and gentlemen. On behalf of International Federation of Red Cross and Red Crescent Societies, thank you for your opportunity to address you on our view on roadmap for implementation 2030 Agenda for Sustainable Development. This roadmap is ambitious, universal, holistic, and more inclusive. As a representative of the largest humanitarian network in the world, I am pleased to emphasize that it is placed on the most vulnerable and most marginalized people. We welcome this roadmap and fully support the statement that achieving the Sustainable Development Goals requires working in a transformative way to implement a set of coherent, evidence-based policies that address health, well-being, and they determine us throughout the life course and across all sectors of government and civil society. We welcome the strong focus as well on resilience, recognizing that the risk of disasters, humanitarian crises, and global health epidemics have the potential to reverse hard-won development gains. In addition to the health threats such as tuberculosis, HIV, non-communicable diseases that become so-called traditional for Europe region and still under strong focus, currently we're facing with trends related to forced displacement, migration, violence, peace, human rights and human dignity that must be addressed if we aim to achieve sustainable development. We fully support the idea of revitalization global regional partnership that are essential to open further perspectives to effective support to the most vulnerable population, and our organization ready to make concrete and practical steps on it. Red Cross and Red Crescent societies in Europe have a wider network of our trained volunteers and 100,000 of our representatives at community level, where we permanently represented local communities and work across a continuum of development humanitarian settings to serve the most vulnerable, now especially with migration situation in Turkey, in Greece, in Italy, in whole Europe and Central Asia. And in this connection, we consider the most resources must be driven to the local level, where needs are greatest and services delivered to address the needs of the most vulnerable people. This unparalleled presence at community level is enhanced by auxiliary status of public authorities and complemented by solidarity and universality of International Red Cross and Red Crescent movement. Our movement is therefore uniquely and powerfully placed to drive meaningful and sustainable change at the community level by building and strengthening resilience. With such partnership with the Red Cross and Red Crescent societies, we have unique opportunities to mobilize efforts, humans, financial resources, experience, evidence-based practice with special countries context to support public authorities, health institutions, a strong auxiliary partner. International Federation of Red Cross and Red Crescent societies endorse this roadmap, and with our network stand ready to partner with governments, UN agencies, civil society, corporate sector and communities themselves to turn these ambitions into reality. Thank you.
Thank you very much. And I now give the floor to the International Federation of Medical Students to deliver a joint statement on behalf of the International Federation of Medical Students Associations, European Public Health Alliance, Studiorum International Association for Hospice and Palliative Care, Worldwide Hospice Palliative Care Alliance. The floor is yours.
Thank you. On behalf of all those organizations that have just been kindly mentioned, we would like to say that we welcome the adoption of the roadmap to implement the 2030 agenda and the renewed commitment towards a joint monitoring framework for the SDGs. We consider raising awareness about the SDGs and their implementation as crucial and laudable, but we must also stress that in 2017, much more needs to be done. We agree fully that without health, the SDGs cannot be achieved, and welcome the call for further investment in health. Yet, we must also note current financial trends with concern. To give one example, although NCDs account for almost 70% of global death, financing for NCD programs remains disproportionately little. In fact, the WHO NCD budget alone lacks almost a third of its funds. Insufficient investment in health will ultimately pose a strain on our patients, and even today, only 13 out of 53 member states have out-of-pocket payments below the 15% threshold, known to cause financial hardship. These numbers show how vitally we need to promote the investment case for health. Too often, health is viewed as a financial burden, whereas in reality, investing in health can lead to a fourfold return. We must also recognize and better harness methods that increase health outcomes and our own financial capacity. Price and tax measures on tobacco, alcohol, and sugar-sweetened beverages can effectively reduce the consumption and the health-related costs of tomorrow. Yet, they remain largely underutilized. Furthermore, community-based palliative care services provided under UHC can help vulnerable households avoid the poverty health trap by supporting both caregivers and patients through life-limiting illness. On this crucial issue of finances, it is important that we learn from each other and that we keep each other accountable. This is why we support the request for the regional director to report on this resolution every 2 years. The European region and the world need financial sustainability and integrity in the health sector in order to achieve the SDGs. The time to act on this is now. Thank you.
Thank you very much, and I give the floor to the World Organization of Family Doctors to deliver a joint statement on behalf of several organizations.
Honorable Chair, distinguished members of the WHO Regional Committee for Europe, the Council of Occupational Therapists for the European countries, the International Association for Hospice and Palliative Care, the World Federation of Occupational Therapists, the Worldwide Hospice Palliative Care Alliance, and the European region of the World Organization of Family Doctors welcome the roadmap to implement the 2030 Agenda for Sustainable Development. The health and social inequalities among refugees are well known, yet they are still staggering. A real humanitarian point of view and urgency in implementing actions are needed. Existing policies must be revised to promote accessibility and appropriateness of the healthcare services for refugees and eliminate exposure to social exclusion. Strategies must be put in place to guarantee access to safe drinking water, food, hygiene, sanitation, shelter, and essential health services for refugees. Particular attention must be paid to the specific needs of the vulnerable groups of older people, those with disabilities and mental health issues, and patients needing palliative care. And even more urgently, we must protect our children. We reiterate, therefore, our call on Member States to recommend, when practicable, the implementation of pre-departure medical examination and reporting for post-arrival follow-up. To this end, we note the role of primary health care in assisting refugees, especially after their resettlement. We urge Member States to consider specific preventive strategies for underage refugees and safeguard them from developing mental and physical illnesses in the future. And third, we highlight the strengthening, standardizing and harmonization of health information systems across the European region can support surveillance and coordination and increase the appropriateness of health services. Thank you very much for your attention.
Thank you very much, and I give the floor to the International Society of Nephrology to deliver a joint statement.
Thank you. Honourable Chair, distinguished delegates, the International Society of Nephrology and the World Heart Federation welcome the roadmap presented by the committee report and its 5 strategic directions. We support the draft resolution and commend its alignment with the Global Action Plan for the Prevention and Control of Non-Communicable Diseases. As the report outlines, NCDs account for 86% of premature mortality in the region. Of these deaths, cardiovascular disease, or CVD, are the biggest killers, accounting for more than half of the deaths across the region. Among those deaths are many who simultaneously suffered from chronic kidney disease, a high-risk group for cardiovascular events and disease. Around 1 in 10 Europeans, in fact, is living with chronic kidney disease, but only 90% of those affected are unaware of the condition. Worldwide, CKD was the direct cause of 1.23 million deaths in 2015. Without addressing CVD, kidney disease, or other NCDs, the Euro member states will not achieve the Sustainable Development Goal of Health, number 3. However, recent global partnerships, such as the Global Hearts Initiative, present timely opportunities to tackle CVD and related NCDs and to strengthen implementation of both Health 2020 and the Agenda 2030. The Hearts Partnership represents an unprecedented alignment among stakeholders in global CVD management, and we stand ready to offer policy, technical, and implementation support to Euro member states. Furthermore, fighting NCDs is pivotal to a number of SDGs beyond health due to their unfortunate and deplorable link with social inequity and the fact that they span the spectrum of human conditions and the life course. To support implementation of the resolution and to complement ongoing progress to tackle cardiovascular diseases, kidney disease, and other NCDs in the region, we make 4 recommendations. Firstly, implement affordable and cost-effective interventions to address NCDs at the primary healthcare level, as outlined in the WHO Global Hearts Technical Package and the NCD Global Action Plan Appendix 3. Secondly, recognize the synergies between the 4 major non-communicable disease and other diseases such as kidney disease by adopting an integrated approach in developing screening and disease management programs for NCDs. Increase resources, thirdly, dedicated to tackling NCDs through, for example, sustainable measures such as taxes on tobacco and sugar-sweetened beverages. Among the WHO regions, Europe has the highest tobacco use among adults. Increasing taxation can reduce CVD risk factors and fund other interventions aimed at tackling burdens of NCDs. And finally, and fourthly, we call on member states to attend the WHO Global Conference on NCDs hosted by the President of Uruguay next month in October. This meeting represents a unique opportunity to strengthening policy coherence on all NCDs across different ministries ahead of the UN high-level meeting next year. Thank you for your attention.
Thank you very much, and may I remind observers to stick to the 3 minutes, please. I now give the floor to the International Pharmaceutical Students Federation.
Thank you, Madam Chair, Madam Regional Director, Honorable Director General, distinguished delegates. The International Pharmaceutical Students Federation is the voice of over 350,000 pharmacy students and recent graduates in 81 different countries worldwide. IPSF encourages the incorporation and inclusion of pharmacy students and pharmacists in public health promotion and health intervention in order to achieve SDG 3, good health and well-being, a component of all other SDGs as well. Pharmacists and pharmacy students can and do raise awareness and educate populations on topics such as tuberculosis, HIV, health provision for women and children, provide services on mental and sexual health, and tobacco and substance use. Countries like Japan and the UK run pharmacy clinics on donepezil use, cancer and anticoagulation therapy have noted positive impacts on patient adherence and pharmacotherapy effectiveness. Guided also by the NANJIC statements on pharmacy and pharmaceutical sciences education, we advocate for pharmacy education to include clinical pharmacy, evidence and skill-based education, scientific research on social and commercial determinants of health, and integrated competence-based practice allowing pharmacists to deliver effective healthcare. We recognize the importance of the Sustainable Development Agenda, align our education initiatives and campaigns to reflect on the SDGs, and ensure our members engage with their communities. On this, IPSF continuously encourages pharmacy students to actively promote global health and engage in high-quality health interventions for communicable diseases and NCDs and other with equity in mind. With a presumed deficit of 4.3 million health workers, we call for all member states to empower pharmacists and pharmacy students with relevant skills as they can contribute to the health workforce and the achievement of the SDGs in a significant manner. Thank you.
Thank you very much, and I give the floor to the Euro HealthNet.
Thank you, Chair, Regional Director, distinguished delegates. Today's society is both unsustainable and unfair. We are creating and sustaining conditions that widen health inequalities. The proposed roadmap to implement Agenda 2030 is not only essential to our survival, but also an opportunity to build a more equal European region and inspiring the rest of the world. The most effective way of linking public health with the SDGs is indeed the determinants approach. The solutions to many of our current problems lie in the too weak or even non-existing links between sectors. There must be a radical shift in governance, finding ways to collaborate across interests and search synergies, including economic priorities. For progress to be made, leadership is essential, and the WHO has a major opportunity to actively encourage other sectors and achieve the SDGs. Resources exist and can be mobilized. People can be empowered to live in ways that promote their health and sustain the environment at the same time. And we should do so by working with them and addressing their real needs and concerns, and pay particular attention to those most vulnerable. So engagement, empowerment, and working with the assets that people have is the key to change. Resources also exist within national public health institutes and health promoting organizations. They have a vital role in facilitating intersectoral work as well as in working with people. However, we are worried. Some national institutes are merging, others suffer reduced funding or are even disappearing. Strong public health institutions and workforces for health promotion contribute to intersectoral action and are essential for achieving SDG targets. Yet the funding for this work represents a very small proportion of overall health budgets and is often inadequate. EuroHealthNet welcomes the roadmap and envisaged national development plans. We are ready to work together with the WHO Regional Office and with Member States through our memberships of institutes and to bring our added value of shared experiences and learning and to help make this roadmap reach its destination in Europe. Thank you.
Thank you very much, and I give the floor to Healthcare Without Harm Europe.
Thank you, Madam Chair. Healthcare Without Harm Europe is pleased to see the WHO roadmap to implement a 2030 Agenda for Sustainable Development address climate change as the public health issue that it is. This roadmap calls for the need to strengthen health systems to be better prepared to respond to health emergencies, such as those caused by the adverse impacts of worsening climate change. To reduce the burden of disease from environmental exposures, the roadmap calls for the need to empower people through education and training. We agree that this is crucial, especially when talking about the healthcare setting, considering the important role that health professionals play in hospitals' emergency response systems. At Healthcare Without Harm Europe, our members are hospitals, health systems, and regional and local authorities, and we work to educate and empower the healthcare sector to reduce its climate footprint, to protect both human and environmental health. We are encouraged by the work carried out by the WHO over the years, calling on national governments to treat climate change as a public health threat, and we would like to affirm our commitment to working with all relevant stakeholders, including national ministries, regions, and local authorities, to build low-carbon and resilient hospitals and health systems throughout Europe. Thank you.
Thank you very much, and I give the floor to the International Network of Health Promoting Hospitals and Health Services.
Thank you. Dear Madam Chair, Madam Regional Director, Ministers, Delegates and colleagues, on behalf of the Clinical Health Promotion Center and the International Network of Health Promoting Hospitals and Health Services, we are delighted to have been given the opportunity to convey parts of our work and experience. The International Network of Health Promoting Hospitals and Health Services has worked with Health 2020 and the implementation of people-centered health promotion activities during the last years, and we are very confident to hear the ideas and experience laid forward today on the SDGs and the Health 2030 roadmap. We welcome a further focus on including the local levels and the intersectoral involvement, and we would like to reinforce the role hospitals and health services can and wish to play in this. Europe's burden of diseases is strongly related to smoking, alcohol, overweight, malnutrition, and physical inactivity. A focus on health-promoting activities in the healthcare sector improves the treatment outcome on long term and help reduce the burden of disease and improve public health on long term. Our center and the network of health-promoting hospitals and health services are currently working on updating the WHO manual and self-assessment form for implementation of health promotion in hospitals. The long-awaited update will, in addition to hospitals, also include patients in other healthcare settings. The update delivers easy-to-implement standards and indicators for implementing health promotion into clinical practice. What we hear from our many members, the healthcare sector and the healthcare professionals are more than willing in playing their part in improving the health of not just the patients, but the population as a whole. On behalf of both the International HPH Network and the Clinical Health Promotion Center, we welcome all delegates to make contact and find out what your office can do to improve clinical health promotion in your country and international. Thank you all for your time and interest.
Thank you very much, and I give the floor to the World Stroke Organization.
Honourable Chair and Regional Director, distinguished members of the Regional Committee. While the world is preparing for the 2018 high-level UN meeting on NCDs, their proportion continues to increase in Europe. Over the last 25 years, stroke has become the second cause of disability and of death worldwide, just after ischemic heart disease. Given this large-scale problem across all countries and continents, stroke is about to affect everyone directly or indirectly. This is an avoidable tragedy for patients, families, and societies, because stroke is largely preventable and treatable. Europe's progress in prevention and treatment of NCDs is modest. It is worth remembering that 90% of stroke and heart diseases are linked to 10 modifiable risk factors that include hypertension, smoking, overweight, physical inactivity, and unhealthy diet. As in neurological disorders, most survivors of stroke carry a lifelong burden of physical, mental, and economic consequences. The World Stroke Organization and the European Stroke Organization call upon the European Regional Committee of WHO to support its member states to increase their efforts in 3 domains, targeted also by the World Stroke Campaign in 2017. Number 1, action. We offer to support the WHO in the development of regional and national strategies to reduce premature NCD death by 1/3 by 2030, in particular through the Global Hearts Initiative. Number 2, awareness. We invite WHO to strengthen programs that increase awareness of stroke symptoms, risk factors, and the consequences of stroke. Our 2 organizations, together with the Stroke Alliance of Europe, will work on improving stroke awareness in 2018 with the launch of the Action Plan for Stroke in Europe. And number 3, access. We support the WHO in its efforts to remove financial barriers to prevention and detection of NCDs, including through universal health coverage. This will allow for implementation of population-wide prevention strategies. Given the major impact of stroke in Europe, our organizations also suggest that the term stroke should be more visible in WHO documents. The symptoms and consequences of stroke are unique and sorely under-recognized. Specifically, we suggest that WHO replaces in the future the term cardiovascular disease by the term heart disease and stroke. These 2 diseases share many common risk factors and treatments and have the overall highest health impact on mortality and disability in Europe and the world.
Thank you very much. I have no more speakers on my list. In addition, we received written statements by the International Federation of Medical Students Association and a joint statement by the International Association for Hospice and Palliative Care, which you will find on the website. So we reached the end of our debate, and then I would like to give the floor to the regional director to respond to our questions and this debate, please.
Thank you very much, ladies and gentlemen. First of all, let me say that I am deeply honored to have His Excellency Professor Recep Akdak, Deputy Prime Minister of Turkey, with us, and I would like to thank first and foremost for his presence here and for his speech, for his contribution, and congratulate Turkey for all the progress that you have made under your leadership, Professor Akdak, during the years while you were Minister of Health, in all the health indicators in Turkey and also in universal health coverage. And wish you all the best in your new assignment in the areas that you are leading now, particularly on emergencies, emergency response, and we are very much looking forward to working with you under your leadership also on this area, and we are looking forward to have our geographically dispersed office finalized and to work with you also very much together on emergencies and preparedness. What you have presented to us, Professor Akdak, is a clear example of what you can achieve if you have political commitment and if you have multi-sectoral action in place. It was also very clear guidance from you that we need a clear mechanism for the multi-sectoral work. We need strong leadership, we need well-prepared action plans, and we also need a monitoring mechanism for accountability. I was listening very carefully for your guidance and for your work. And this is actually why, at your request, we have developed a roadmap that is on the table ahead of you, emphasizing exactly the same issues. And also on the monitoring framework and accountability mechanism, we have proposed an integrated monitoring framework. We also listened very carefully to your guidance on reaching out to presidents and prime ministers to support the health ministers, and we fully agree with you. This is what we have been saying also in Health 2020. And now with Dr. Tedros as a new Director General, this has already become a reality, because during the first 2 months while he has been in office, he has done a lot already within the G20 and within his bilateral visits to reach out to many of the presidents and prime ministers, and we are doing it also as regional directors. And the next conference, for example, on NCD in Uruguay, in Montevideo, will also be organized in this way. And thank you also for mentioning the Health 2020 as leading the way for the SDG implementation, and particularly the experience of this region in the whole of government, whole of society approaches, and your acknowledgement that the Health 2020 will help with the SDG implementation. And I am sure that Turkey will be well positioned also to move forward with its indicators and to reach the SDG targets up to 2030. So I would like to thank you very warmly for being here and for your kind words. I would also like to thank the panelists as well as the stakeholders for their very important input into this discussion. And I cannot pick up on all the issues in the REACH discussion today, but I would like to come back some of the issues that have been raised by the member states. First and foremost, there was a lot of guidance on the joint monitoring framework. 9 of you have commented on this, and indeed our goal is to reduce the reporting burden. And this is also why we have established the European Health Information Initiative, which now has 35 members, and we also have a good collaboration with the EC and the OECD, and then on the margins of this regional committee, we will also give you further information on this. Our team, under the leadership of Claudia Stein, will immediately swing into action to establish the expert group, and please send the nominations to her by the 15th of October. And this working group will also deal with important issues of definitions, which was raised by Switzerland, and the types of indicators. And we also appreciate the suggestion of using the Euro Gateway, which is an excellent one-stop shop for health information in our region, and the team is ready to receive the data and share instantly with WHO headquarters. Then we received questions from Monaco on the issue-based coalition on health within the UN framework, which we are leading. As I said in my speech, we are working on 4 major priorities. The first meeting was organized of these working groups last November, last year, and we developed a joint work plan. Since then, we have been working together, and we focus on accelerating programs in specific countries through pooling resources among the UN agencies. And then at the next meeting of the European Coordination Mechanism within the UN, which will take place in October in Venice, we will have to report back, and I will be there to report back on behalf of all the UN agencies. And we also have to develop the work plan for the next year. So this is very much under control. There were also some very useful comments from Switzerland, and thank you for that. You asked for guidance to work across sectors, and I am pleased to let you know that we developed fact sheets on all health targets, including action from all the sectors, and they are available, and also fact sheets on how, on their presentation on health action, fact sheets on the how we should work together in this work on health action and in all the goals that are in the SDGs. Then with regard to this issue of the coalition that we have set up for public health, which was raised by Finland, indeed the next meeting will take place in Helsinki, the second meeting, and thank you Finland for hosting it. And you may recall that in 2012, the Regional Committee, parallel to Health 2020, also adopted the WHO European Action Plan to strengthen public health capacities, services and infrastructure based on the 10 essential functions. And in 2016, last year, we submitted a midterm report on the implementation to you. And the major finding was the gap between declared commitment to public health and the actual resource allocation. And this is why basically we have set up this coalition of parties to take care of these issues, and work has been going on. But you may also recall that Finland initiated the World Health Assembly Resolution 69/1 in 2016 to strengthen public health in the universal health coverage, linking it to SDGs. And then WHO headquarters asked our team, under the leadership of Hans Kluge, also to lead the development of a global narrative on the importance of public health in universal health coverage within the SDGs, within the Global Category 4 network. And the second version will be ready now to be published in the WHO bulletin at the end of this year. So this work has already been taken care of. And then also as part of the development of this roadmap, we have further developed our European vision on public health, and there is an information document on our website, which we will take further and discuss with the coalition of partners within the UN and also in the Helsinki meeting. So with this, I think, Madam Chair, the last comment to make is that, of course, thank you for Estonia for the input on behalf of the EU and all the comments on the resolutions, and we are very happy, of course, to accommodate all these proposals that have been made by the EU member states. And with that, back to you. Thank you.
Thank you very much. Before concluding this rich discussion, I would now like to consider the adoption of the proposed draft resolution contained in EUR/RC67/ConfDoc4-Ref1, the roadmap to implement the 2030 Agenda for Sustainable Development, building on Health 2020, the European Policy for Health and Well-being, and its financial implications contained in EUR/RC67/9, Addendum 1. Is the committee willing to adopt the proposed draft resolution as amended by consensus? I see no objections. The resolution is therefore adopted.
Great.